Good evening. Hello. It is, just checking the clock, 7:34 on Tuesday, March 10, the year 2020. I do not need to call the meeting to order because were already called to order earlier because we had an executive session prior to this public meeting, but we are out of executive session and now in open session. So I welcome everybody here. I am Eileen Jay, the chair of the school committee. With us this evening are my colleagues. To my right, I will introduce our newest colleague, Sarah Cuthbertson, who was newly elected in our town election. So we want to congratulate Sarah, even though it was uncontested. I know she worked very hard during the time she was campaigning. She went to many, many events and answered questions in writing and in public. So because I know she felt that even if it's uncontested, that the public needs to know what her thoughts are on issues and what her background is. So we appreciate all the work you did for the campaign, and welcome. Sitting next to her is our colleague Scott Boken. To my left is our colleague Deepika Sani and Kathleen Lenahan. Sitting next to me is our superintendent, Dr. Julie Hackett. Over there on the far left is our student representative, Sarah May. And taking the minutes for us this evening is Kristen Croning, our executive assistant. So before we begin, I need to ask if there's anyone in the audience who will be recording any portion of this meeting. All right, seeing no one, we will begin our agenda. Just so that you know, the way we have been doing our public comment session is that we have typically, after about 45 minutes into the meeting, we do what we call community speak. This time, because of our executive session, we're starting a little later, so we'll conduct some business and then we will have our public comment period. So we typically start with school committee announcement and liaison reports, and Sarah will be delighted to know that I'm going to call on her first.
Okay, it's on.
So you need to bring the microphone down.
I'm learning. Well, thanks, everyone. I'm really excited to be here for my very first meeting. I actually do have two announcements. 2 weeks ago, I had the privilege of attending LHS had a Black History Month museum, and I got to go after school hours to really see it, and it was just amazing. So many of the departments worked together to put together a multimedia exhibit. They brought in guest speakers, which were during the school day for the students. But I know the website that they developed to go along with the museum is floating around out there somewhere on the internet. So if you find it, take a look. It's worth checking out. And the other announcement was I went to the Lion King last Thursday at Diamond, and that was amazing. I was a musical kid growing up, and just seeing the level of performance that they put on in a middle school was really exciting to see.
Thank you. Mr. Boken.
I wanted to welcome Sarah. Welcome. I have a new person sitting next to me. My only announcement is I wanted to thank Town Manager Jim Malloy, the Select Board, and Dr. Hackett for appointing me to the Human Rights Committee. I'm now a voting member, not just liaison, but now I have the power of one vote. So I'm looking forward to actually being more of a part of that committee, and I wanted to thank everybody who is supporting me to do that.
Thank you. Ms. Sani.
So I don't have many things to report back about because appropriations and capital expenditures are just going through the warrants, the town warrants, and so I have let them do that peacefully. What I do want to talk about is that on the finance committee with Kathleen, the subcommittee with Kathleen, so I look through the warrants every couple of weeks or weekly, and I saw one thing that I had to sign which gave me pause, and it was by an LHS club or an activity club called Helping Homeless, and it is advised, or the teacher advisor is Lauren Venti. And what gave me pause was that this group of LHS kids were making a donation to Rosie's Place for the sum of $1,398. And I just really like that. I like that compassion was alive and well, and our LHS students were doing that. So I'm hoping I'm not breaking any laws or rules in talking about this, but I thought I should bring this to everybody's notice.
Okay, thank you. Ms. Lenahan.
Well, I just also want to welcome Sarah as our new school committee member. I'm very excited to have you on the committee with us. And my only announcement is that the Lexington 2020 committee has organized an event on April 2nd at 7 p.m. in Cary Hall called it's the Futures Panel, Challenges and Opportunities for Lexington, to talk about we have a speaker talking about economic trends affecting Lexington's future. Dr. Hackett would be speaking about emerging education and technology trends. And then we have another person speaking about smart cities and towns of tomorrow. So we're all going to keep our fingers crossed that we will, we will have a futures panel on April 2nd. As we know, it's a challenging time, but hopefully, we'll see people there at that event. It should be great.
Thank you. I also want to welcome Sarah Cuthbertson as our new colleague. Very excited to have you here. And I'd like to take the opportunity to also thank Kate Colburn for her service on the school committee for 3 years. She worked so hard, and we will miss her. On announcements, I last week attended an event at the community center that was asking for the community partners for the community center to come and give some input on things that were going well and some ideas for the future. The reason that they are doing this, they're going to have this event annually for the community partners for the community center, because prior to this there had been a task force that for the community center to provide input on uses and ideas and some suggestions directly to the community center. I think the select board decided that particular task force was no longer needed, but they would want to continue to get that input. So they are going to have this event every year. So it was nice to hear that they were asking people for what ideas they had for serving the elderly, as well as a number of other things. So that was a good event. I also wanted to announce that this March 14th, this Saturday morning, the Parent Academy will be held. That is an annual event that is co-sponsored by SHAC, which is the School Health Advisory Council, in conjunction with a lot of other groups in town. Every year they bring in people to talk on various topics on parenting and health for students and safety issues. Often they will have something on vaping and sleep, all kinds of important topics that are highly relevant to parents of all ages. So I encourage people to check that out.
Depends on the size of the gathering.
Yes, I know. Maybe it's premature to say. I just wanted people to be aware of it. Obviously, as we know, things are changing day to day on public gatherings, so put that on your radar. But definitely, I think there will be information daily on what events will be taking place, and what attendance on those should be. So. But I just wanted people to be aware of that, that event happens every year, and it's highly worthwhile. I'm now going to go to our student representative for her report, or any announcements that she has.
I have a pretty short update, too. For Caring for Yourself and Others Day, I know Dr. Hackett talked about it last time when I wasn't here, but to say it again, Caring for Yourself and Others Day will be a school-wide event on the I-blocks of Thursday, March 19th and Wednesday, May 27th. Instead of focusing on academics, these two I-blocks will be dedicated to activities that help students unwind and focus on themselves and their needs. We're still collecting ideas for I-blocks that students would like to participate in. Secondly, I wanted to thank Dr. Hackett and the entire school committee for the way that they have approached the coronavirus. A lot of high schoolers look towards the town school committee and Dr. Hackett for reassurance, and for this reason, I wanted to thank you for the frequent updates that you have sent to the faculty and Lexington residents. I wanted to thank all of you for continuing to make the health and safety of Lexington students your first priority. There are posters all over LHS about proper hand washing technique, not giving handshakes, and not rubbing your face. And I think that people are definitely paying attention to hand hygiene and definitely more cautious, which I believe is a good thing and stops the spread of any germs, not just the coronavirus. There are people who do choose to wear masks, and the general student body is very understanding of their decision. I've seen students come up with very interesting and elaborate handshakes to greet each other instead of hugs, which I think are super cool. We're definitely making the best of the situation at hand. And finally, I just wanted to say congratulations to Ms. Cuthbertson on being the newest elected member of the school committee.
Thank you, Sarah. Okay, thank you. I just was, the next item on our agenda is typically Dr. Hackett gives us the good news, always, with the congratulations and celebrations, and she can start on at least one of the items in her superintendent report before we go to public comment.
Good evening, everyone. There's always more good news than I have room to report it. So we have lots of exciting information that will be in my next report about competitions that students have gone to and so forth. Tonight, I want to congratulate Sarah Cuthbertson on being on the school committee. You are always in the room, so it doesn't feel particularly unusual, but we're really glad you're at the table with us, so welcome. And I want to congratulate Deepika Sawhney, who she will be embarrassed because I'm saying this publicly, but she just found out that she got accepted to the Master's in Policy Management program at Harvard, so yay for everybody. And I have more embarrassing news for people, and this is for Jared Cassidy, and he gave me permission to share it, but he's not that kind of guy who would share his information, much like Deepika. He has done something extraordinary, so I wanted to tell you a little bit about it. He doesn't think it's extraordinary, but he's wrong. So I'm going to read to you the congratulations for Jared Cassidy, who is our K-12 Performing Arts Coordinator. He was nominated for the Global Teacher Prize, sponsored by the Varkey Foundation. As noted on their website, the Global Teacher Prize is a U.S. $1 million award presented annually to an exceptional teacher who has made an outstanding contribution to their profession. Although Jared was not selected for the prestigious award, he advanced to the third round of finalists, making him one of the top 100 educators in the world. Since Jared was one of my first hires in Lexington, I was so honored to add my letter of recommendation to his application packet. He's an outstanding educator and leader who is so worthy of recognition, and apparently others realize this too. While he did not win the $1 million prize, he is one in a million as far as I and we are concerned. I know I speak for many others in Lexington when I say that we are so proud of Jared Cassidy and his outstanding achievement. And that will conclude my congratulations and celebrations, and I just wanted to say to Sarah May that I tried to deliver your report like you would, and you do far better than I did, so we're glad you're here with us.
Thank you. Yeah, why don't you cover the number 2 on your superintendent's report, and then I think we will go to public comments so people don't have to wait quite so long. This is close to the typical time we do it. And then we'll continue on with your superintendent
Okay.
report. Thank you.
This is more good news, but it's more business-type news, so I wanted to announce administrative appointments. On June 18th, 2019, I appointed Mr. Thomas Martelloni, the Director of Innovation and Instructional Technology for the system. Mr. Martelloni has done an outstanding job getting up to speed very quickly on all instructional technology-related issues. He's also made innovation a priority and made sure that we don't just think about innovation as it relates to technology, but obviously that's a nice link to it. Tom has done some impressive work with his team. They are a really high-functioning team with a lot of work. For example, the whole IT office moved from the high school into the central administration building, and doesn't seem like it's a big move, but there were lots of moving parts to it, and they did it seamlessly. In fact, I think Tom tweeted a picture of him moving some materials himself onto the moving truck. We also are pleased with the fact that Tom and his team successfully deployed approximately 2,500 devices and fully implemented the one-to-one computing for students in grades 3 through 12. And finally, they reduced the approved capital technology budget by about $1 million over a 5-year period of time. Now, this would have been the budget that was already pre-approved, so he went back, sharpened the pencil, and figured out what we, in fact, really need, and he's just done a terrific job. It's been a pleasure to work with Tom at the district level, and I'm pleased to announce that I will be extending his contract. Mr. Martelloni is an asset to our school district, and we look forward to working with him for many years to come. And so if you remember, when you bring someone from the school administration level to central office, that creates vacancies, which is always a challenge. But I have always believed strongly that people have a right to advance in the system that you have, and creating those pathways keeps great people with us for longer. So when Mr. Martelloni departed last year as principal of Fisk Elementary School, we had a vacancy. And we all know that finding the right person to take on the demanding role of principal can be a challenge, not just in Lexington, but in any district. Fortunately, we were able to tap into some of our excellent internal administrative talent. So on August 2nd, 2019, I announced the appointment of Mr. Brian Baker to the position of principal of Fisk. Soon thereafter, I appointed, because Brian was the assistant principal, creating another vacancy, we had a bit of a domino effect, I appointed Mr. Chris Way to the position of assistant principal of Fisk. I've had the opportunity to observe both Brian and Chris in meetings, during staff meetings, and through their many interactions with parents, staff, and the community and students. I've talked with several of their colleagues and school community members who have expressed their appreciation for the smooth transition and for the talented leadership team that they are. It's my pleasure to announce that I will not reopen the Fisk administrative search on either position, and I am extending the administrative contracts of Mr. Brian Baker and Mr. Chris Way, and also I am grateful for their service and look forward to working with them both, as we all will. And that concludes that portion of my report.
Thank you, and congratulations to all of them. I know that they have all been doing a terrific job this year, and it's nice to know for them and for us that they will take that on an ongoing basis. Please convey our thanks to Mr. Martelloni for the finding cost savings in that 5-year technology plan, because anywhere we are able to do it, especially savings of that magnitude, is just going to make things easier and allow us to use money wisely and put it to good use in other ways. So please thank him for that. So as I said, our timing's a little bit off tonight because of the late start. But we will hold our public comment period now. Let me just review for those who have not been to our meetings before. Let me just review what we do in our community speak period. We will take comments on any topic, including those on our agenda or those that are not on agenda. Those who wish to speak can come to the microphone. Every individual has 3 minutes to speak. We ask that you start by telling us your name and your address, and then you will be able to speak for 3 minutes. We will try to get everyone time to speak. Obviously, if it goes on too long, we may need to just have a limited amount. So, in light of that, I would just ask if things are continuing to repeat and repeat and repeat, that maybe people might want to give enough time so that everyone who has something to say has that opportunity. The other thing that's, I think, important for people to know is that we have these community speak sessions because we really very much want to hear what's on the minds of the public. We want your input. We do take what's said into consideration. However, the public comment period is not a dialogue, so we're here to hear your input. Don't be frustrated if we don't respond. We're not obligated to respond in the moment, but we definitely take into consideration everything that's said, and if there are points made, it's something that we can take up at the appropriate time when it is on our agenda for discussion. So that said, I'm going to ask anyone who would like to speak to please line up at the microphone. Either microphone is fine. State your name and address, and you will have 3 minutes.
Thank you so much. Dear Dr. J and the school committee members, good evening. Thank you for the opportunity to speak here. I'm Rose Sue. I live at the 74 School Street. I'm a mom with 2 kids who attend Lexington Public School, and I'm a longtime resident in Lexington. I'm here to represent 150 parents, Lexington Public School parents, to make a petition. As novel coronavirus outbreak intensified in Massachusetts past couple of days, we would like to petition Lexington School Committee to request Lexington Public School to allow students whose parents agree on learning from home in next few days to study from home through online resources and support without attendance penalty, as long as they can finish their homework, projects, and make a test upon returning back to school. A dust in history is a mountain for family. It's a quote from a writer whose theory made famous during city Wuhan's lockdown. We learned from devastated loss in Wuhan past 2 months, as well as in Milan recently, how highly contagious the novel coronavirus is and how fast it can spread inside a family and a community. We also know from the study that this virus is a lot more fatal for parents and grandparents, and it's very hard to prevent because of a symptomatic infection. Biogen has reported 7 confirmed cases from the conference in Boston since March 5th, 41 in Middlesex County. It has been more than a week since the conference started end of February. It indicates that the virus hasn't been detected and has potentially infected many people in that week. There are many Biogen employees living in our community. Last Sunday, a Bowman Elementary School parent has been confirmed as one of the 70. As a town with a very diversified cultural background that we're very proud of, we also have rich connections with Asia and Europe through family and business travel. The risk of exposure to novel coronavirus in our town is very high. Today, Governor Baker just declared a state of emergency. We're racing against the spread of coronavirus in our school and community. We strongly feel our petition above can help mitigate the risk for our families, our teachers and school staffs, as well as allow Lexington Public School to work with school committee, town house board, and the parents' representatives to implement an emergency action plan in the coming week. I want to make my conclusion to thank for the school committee. Lexington Public School has been an excellent place for our children because of dedication, hard working of our teachers, principals, superintendent, and the school committee. We're in this together. I'm here because our community really cares. We want to protect our children and our community. Thanks for listening.
Thank you. I also want to say, if there is anything in writing you'd like to submit to us, that's fine. I believe we have what you just read, but if there's anyone else who has something they would wish to submit, that's fine as well.
I usually do not. My name is Jiang Zhu. I live at 48 Baskin Road. I have one kid in senior now. And I usually do not wear a mask, but thank Dr. Hackett that you allowed, send a letter to say no discrimination at the school. Of course, at the school committee meeting too. Thank you so much. And in a little closer. Okay, sorry. Oh yeah, sorry. Thank you. Yeah, and in later January, we Chinese parents know how serious situation in China. So we, Calex and Cal send joint letter to all the Chinese families, say, advise them to self-quarantine 14 days as federal government suggested. And also Dr. Hacker, is very nice to meet with us and, to take, some consideration too. And on the February 2nd, we send Dr. Hacker a letter. And so that we suggest, to maybe, you can allow the people who needed to be self-quarantined to be out of school. And it's very nice for Dr. Hacker to let the middle school and elementary school students to do that. And but high school, at that time is a no. And we understand, so we try to work out. And in late February, because Italian broke out, when we heard a lot of students are coming from Milan, Rome, and from Europe, a few dozen of them, and 2 of them are sponsored by school, and we were really worried. So we sent Dr. Hector another letter, said, there's a situation, and we really know that some, like 1 or 2 kids were sick, and some kids probably were being tested. And so that we suggest again that maybe just remind them to follow the government CDC guideline to, whoever needed to be self-quarantined, school will try to provide support. Of course, the letter sent out said, nobody will be forced quarantined, which is, I think, is, it's encouraged the other way, which we are not so, pleased. And then on the then later, we asked a lot of, parents asked a lot of other activities. Then, of course, it take, we understand it will take school a long time to do that. But, we said at least, maybe you can, give us students, especially senior, who are almost finished, sometime to allow them to start at home. Maybe just one day, 2 days, until, the school and the town can figure some action plan. And why, especially also for Bowman kids too, right? Because they are not so happy about just the clean, right? So I think my time's up, right? Okay, sorry, I'll finish up. And so we understand, and but as Bowman principal, 5th principal, send a letter to everybody else. So this will be on excel leave. And the LG principal also said, hey, we'll follow the book. And of course, Dr. Hacker sent this morning also reinforced that is on excuse leave. And of course, fortunately, Governor Baker has announced the state of emergency, and also announced that the education department will allow school to lose that. So we seriously hope Dr. Hacker and along with the school committee members to really think our request. Maybe, just give us 1 day tomorrow, so we still can relax 1 day. Then, maybe you can, yeah, exactly. My point is that, it's like, young, no, I have very old grandparents, and also I'm old. So my fertility rate is much higher than the kids and a lot of parents here, right? So that's why I'm one of the most active activities here. So thank you so much for your consider, and also thanks Dr. Hector a lot of time. I'm sure you are as much worried as us probably more because you have all the kids. We have our one child. You have all the kids. Thank you so much for all your work. Thank you.
Thank you. That's absolutely true, and we take that responsibility very seriously. A lot of children.
This is Dr. Wigmore from Harrington District. I have 2 kids in Lexington, and I moved from Washington State here not long ago. So I'm here. Actually, they too have said much about the coronavirus. So I'm a healthcare practitioner. I'm a board certified diagnostic director, and I'm working with still working with my lab in Washington State to validate the COVID-19 test to help patients there. So my college classmates are still fighting in Hubei, China. Actually, they are taking care of the last batch of patients in the intensive care unit. So I'm here just to share some of the fact we have learned from the battle of COVID-19. So much of this being said, I'm sharing some of the numbers. So I know I wear the mask, which is maybe unnecessary because the risk is considered still low in Massachusetts, which I actually agree. But what's intimidating is that how fast this virus can spread. Much of data have shown that, for example, the biology meeting, none of them showed symptomatic before the meeting. And then after the meeting, till now, more than 40% of attendees are tested positive. We actually had a model based on our data from Wuhan, Hubei, to show that if there's one person test positive in a crowd, for example, in this room, they will likely be infectious 2 days before they show symptom, and from anywhere 25% to 50% of all people in the same room will be affected in that 2 days. So that's a little bit not that clear when we just say the percentage, but when it comes, let's say, I have a girl in Harrington, and she contacts about 100 people every day, and they over the 2-day period, it would be at least 25 of her contacts will be affected if my daughter show a symptom, and she grant herself or quarantine in hospital as soon as she showed a symptom. So in that case, at least 25 people will be positive in Harrington School, and that's associated with 25 families. Probably over 100 people total will be affected. So that's why things get a little bit outrageous or out of control in both China and Italy and many other countries like South Korea and so on. So this is the major difference between this virus than Ebola, HIV, and many others. So because of it's not that fatal actually. Only 10% of people will be in danger or show severe symptoms in the ICU, but it spreads so quickly, and the ICU will be full of people as soon as this virus gets spread out. And that's the reason why a lot of the government declare emergency as soon as they see over 10 people infected in the state or so on. I think it's probably good to share my numbers to as many people as I can. It's just to be cautious. We should keep distance and not gather like a crowd for any occasions. And thank you very much.
Thank you.
All right.
You need to speak in the microphone. Thank you.
All right. I have 2 kids.
Please tell us who you are and,
Okay.
and your address, please. And then-
My name is Wei, and I have 2 kids in the Lexington school. So one is high school. It's 11th grade. So as everybody know, 11th grade is very, very important, right? And the other girl is in the 7th grade. So the first question, the first thing I want to let you know is, other than the 2 girls, I have 2 elderly. They are all around 80 years old. They are living with us. So now that I'm facing a question, how I'm going to protect the 2 elderly in my home while sending my 2 kids to Lexington High School and the middle school. The high school has about 2,000 kids, and plus the faculty close to 3,000. So this is really a risk factor for us, choosing between our kids. I mean, the 11th grade, it's a very important year for her. She has to doing very well so far, but should I continue sending her to school and think every day thinking about, will she bring the virus back and what I'm gonna do with the 2 elderly? And I see the situation in Seattle, in the nursing home, right? I keep saying that this is just a bad flu, but it's not. Have you ever seen a flu kill 30 people in a nursing home within a week? This is not a flu, especially to the elderly people. So this is a very, very bad situation for me. And also that, I see other schools, college, even the private company are doing a lot of things. I know the district have done a lot, cleaning up, teaching the kids how to wash hands. I mean, my younger daughter even come home and teach me how to wash hands, So, I mean, I very grateful that the district, taking those actions to teach the kids, but I still feel like, can we do a little bit more proactive? We see more and more college that are closing their door now. And even my company are now putting up to no more meeting than 25 people. I think this is not qualified. Even group meeting, team meeting are all encouraged to call online. I think at least we should give parents like me or my kids the choice of staying home, the choice of protecting my elderly. I mean, for me, it's a battle between my kids or my parents, right? So that's all I want to say. Thank you very much.
Thank you.
Hi, my name is Helen Yang, 1 Solomon Pierce Road. Hello, everyone. First, I want to congratulate Sarah on joining the school committee. And I was also very impressed by Sarah May's speech. It was so fluent and so beautiful. So I cannot be more proud of the youngsters we have. So great. And I just wanted to echo what Sarah said earlier about thanking really everybody here, Dr. Hackett and all the school committee and the town boards, Board of Health, and you have been working extra hard during this time of uncertainty. And I know the state government has not been made it easy for you because you have to follow their guidance. Their guidance may not be the most appropriate, may not be most up to date. So you have been, operating under constraints. And, it's also a learning process for us. We have come to realize what the responsibility delineates between the schools and between the Board of Health. And one thing that I've learned today is that the attendance, that's actually one of the reasons I came here, because I have a friend who cannot come here, but she has an urgent question about attendance. And then, you have seen this is a theme here. And I know a lot of decisions are difficult, whether to close the school and what you can do on those quarantine. I come to understand those are the Board of Health, it's their responsibilities. And then, but the attendance policy, it is is under the purview of the school committee and the superintendent and the principal. And then, from my perspective, my kids, they love school. They want to go to school. So, so it's really for my friend who is more concerned about this. And then, from my perspective, I feel like we don't have anything to lose by giving them excused absences if they choose to stay home. So I figure there's probably something that I do not know. There may be considerations you are aware of, you are considering that we are not aware of. So if you don't mind sharing with that. And then I know there's a policy about 1 N versus 2 Ns. So my friend's child already has 1 N in the previous quarter. So they are very, they really needed the excused absences. So if you could just share some of the considerations why you are doing that, that would be very much appreciated. And I also wanted to say how much I appreciated your earlier response canceling the large events even before the governor declared the state of emergency. That has been a big concern for me. I really appreciate you taking the proactive steps. Thank you.
Thank you.
Hello. Hello, everyone. Good evening. My name is Jay Liu, and I live in 19 Donald Street. I've been living in Lexington for 10 years, about 10 years. I have 2 children, one in middle school, 7th grade, and one in high school, 11th grade. So I come here to make a petition, to make a proposal. Please close the school as soon as possible. Please. Besides the reasons that previous speakers have mentioned, the Massachusetts is in state of emergency. We got a number of cases growing exponentially in the last couple of days, and also public schools, public universities and companies are shutting down there as well. One factor I want the committee to consider, right? Here, probably decision has been made based on the factors we're taking from the health board, government, right? But please consider another source of information. In Lexington, we have a larger community of Chinese Americans from China, right? And a lot of them are professionals, and about 1/3 of them are working in the biotech health care industry. In the last 1 month or 2 months, maybe 2 or 3 months, this community has been monitoring the situation in China very, very closely because of family connections, right? And we have seen horrible things there, right? It is 20, 30 times more deadly than flu, right? The death rate for 40 years old is about 1%. For 60, 70 years old, maybe 10%, right? And it is so easy to transmit between person, and people can transmit the person before showing symptoms, right? And nowadays in Massachusetts, we only have 50 tests a day, right? So this is why we have 90 cases. But most people estimate, if you look at newspapers, Wall Street Journals and Boston Globe, from health professionals, from Harvard public health professors, it is reasonable to expect that maybe a few thousand people are already in Massachusetts carrying virus, right? And the school is a central place for people for the virus to spread, right? Yes, we did remember the Bowman School. The Bowman School, yes, we shut down the school. We cleaned the school. Those 2 kids were in school, right? But those 2 kids have been in Bowman School in the last 2 weeks, where the parents are showing symptoms, maybe carrying the virus, and they may have transmitted their virus to their classmates. Their classmates have brought their siblings in Diamond School or Lexington High School, right? It's a fair, well, if you look at the exponential growth of the virus, spread, I'm very, it's if you look at China, you look at Iran, look at Italy, we are heading in that direction. We need to be proactive rather than reactive.
Thank you.
Thank you.
Hi, my name is Li Junkui. I live in 9 South Range Avenue. Yeah, I have one child in the Lexington High School, a senior. Actually, he's old, like more than 18 years old. He just do the vote for his first time. Yeah, he do analysis, he watch the news. Actually, he likes school, he want to go to school, but every morning he a little bit struggling. If not go, I'll stay at home. Yeah, so this is I saw that. But so another thing, I also is I have a tutor school in nearby. So our school already did the online class because the parents have a concern. I think that is very smoothly because a lot of parents understand. We use Zoom, and also each user each room member can have 100 attendants. So they have a whiteboard, and they also can share screen. And I also know a lot of the Lexington High School use a Google Classroom. I think that one can submit their homework online things. Yeah, so this is I just I also talk. A lot of parents also can help if the school don't have enough money. We can contribute some money to can help to do the online things. Yeah, so we also have experience we can share with you how to help the online thing. And also I know a lot of big company already allow the staff can working from home. So I think maybe it's not to have problem like for the parents to stay at home with the child. Then can parent working from home and then the children study from home. I think it's not like a big, very difficult right now because I know my sister already working from home. They are a big company. So this is my thing. And also finally, I want to, if the school can give the kids a few days non-excuse, that'd be best because my son every day is struggling, go to school or not. Yeah, thank you.
Thank you.
Yeah.
Good evening. I live in Lexington. I live on Lawrence Lane. I have 2 boys. Tonight I'm here for my boys. I'm a very shy person, introvert. But I feel like I need to communicate to let people know. And I'm so encouraged by everyone's you guys focus on everyone, so encouraging. I can see that sincerity from your eyes. So thank you so much. Thank you. I didn't prepare. I drove right back from my company. I work for a medical device company. As a regular affairs specialist. So I work with FDA. So I am very data driven and analytical. So I like to start with my some of my analysis. So Biogen had a meeting on February 27 and 24, Thursday and Friday. And then the next Thursday, which is March 5th, we heard that Biogen employees went for testing. And then I think there was 7 or some numbers tested presumptive positive. And then March 8th, which is a Sunday, we heard Bowman's news. And I also I read papers all the time, peer-reviewed journal articles. So, and there's one article talking about people can be contagious 2 to 3 days before they become before they have symptoms. So, let's assume the mother went testing on Thursday. So she probably has symptoms already, and then. So my concern is that the kids might have been infected, and data show that the kids usually do not have symptoms, but they can still infect people. So you already know where I'm going. That my concern is that there might be kids infected, and then we'll have this chain reaction. So that's one of my analysis, which. Have some data, but still some of my assumptions. So the second is, so I heard from the today's governor's news conference that we have 92 now in the States, 70 from Biogen, and 4 due to travel, and 18 unknown. So, which means I heard WNPR like last week. If we have unknown, that means community transmission starts, and that further means that there are people potentially already infected, but we don't know yet, because if unknown resource can infect people tested, it can also pass the virus on to people who haven't been tested yet. So my concern is if there is community transmission, then our schools might be in danger, because a lot of people in the same building, and we sanitize, which is great, but if one person is infected, that can still, so it's a mobile virus. Sorry, I don't mean to say that. You know what I mean. So that's I'm concerned about the school might have some kids tested positive someday. And third, Italy now has 10,000 people infected and 631 died today. And our strain came from Italy, so that's the same thing. And my family, I have parents, 70, about 80 living with me, and my husband has high blood pressure, cholesterol, glucose. He's taking medicine, and he had pneumonia last winter. He's still coughing sometimes. So I'm very stressed. I lost sleep actually the last few days because I kept my high schooler at home, and I cannot keep him too long because he will be punished. And you know, as Chinese parents, we think academia score is the number one important, which should not be right. Yeah. So I sent him to school, and I couldn't focus on my work. I was so anxious, so I pulled him out of school, and then I worry about his academia score. So I struggled and lost sleep. I tried to do yoga every night, but it couldn't help. And I don't go to my yoga studio because I'm afraid of virus. Yeah. So that's another point. And so the data show that children, the data from WHO and China CDC data showed children's 0 to 9 years old, their death rate is 0%, and 9 to teenagers is 0 point something. But there is a fact, because early on when the outbreak started in China, because Chinese people, we protect children, number one. So all school closed, online study started. That's why the infection rate is low. I think that's one of the reasons. Of course, children have better immune system, their lung is healthier. That's one reason, but I think that's another reason. So okay, my request, or not request, I don't know if that's a polite word to say that. We use this in the email, working email. My request to my colleague, please send me the report or something. I don't know if that I should say that to the committee. This is my first time here. So I would like to ask for excused absence if I'm very concerned about my kids might come back with virus given to my husband, my parents, and I am such a worry worm, and it's gonna be and my immune system will be very weak if I worry too much. So I think it will be devastating to my family. So if school could give us a few days to keep them home and to see after the Italy, the Biogen, after the window, maybe I think I will feel more comfortable send him back. And I promise I will be a very strict parents to make sure that he study at home. They already complain about my homework than schools. They think my homework is worse than schools.
Thank you
so much. Thank you.
I think we're learning that there's a new number one. You know, maybe academics felt like number one, but I think the health and safety of our children is the number one for all of us. Thank you.
Hi, good evening. Thank you for being here tonight, providing the opportunity for us to speak up. I'm William. I have two children. One is 11th grade, one is 7th grade. So I want to echo back the lady just mentioned that I urge the school district give her the options for the excuse absence. For us, for the options, at least we give the options for concerned parents. So if they have to juggle, like the other lady said, you know, older parents at home, that which pose a great, if you look at the math that was posted by CDC, for over 80 is a 14%, over 80%, 14% fatal rate. So that's one request or urge. The other thing is one of gentlemen previous mentioned about closure of the school. I don't know how ready the Lexington school is to bring this class online. There are many, there are technology available nowadays if we should choose to do so. I suggest school maybe start a service. You know, I believe many families now has a Wi-Fi at home. They will be able to attend school online. So maybe at least get a survey out which family they don't have Wi-Fi and things like that, don't have computer and things like that. At least get a survey out, and when the situation arises, and at least we prepare and are ready for bringing this class online. Thank you.
Thank you. Okay, why don't we take one more, because if we keep going on, we won't have the chance to have the discussions that we need to have. So if there's one more person who would like to, I think we did. So, but if you would like to speak, please come up. Sure, and you too. Is there anyone else who want one more? Okay, why don't we take these last two speakers and then we can turn back to our discussion.
My name is Qiang Fu. I'm living in Namba Centennial Drive in Lexington. I live in Lexington for 18 years. I have 3 kids in high school, middle school, and elementary school. Actually, I'm here actually echo a lot of parents their opinions. I didn't prepare anything, so just a couple. Maybe a couple of things what I want to bring up. One thing, you probably see a lot of Chinese parents come here, and I think most of us actually kind of witness a disaster in making in past 2 months. It's really horrible, and there's a lot of really sad moments. You know, the entire family is gone, and also a lot of hospital workers, doctors, young doctor, nurse, lost their lives. So it's. And then we've seen that horrible movie. It's almost like a horrible movie. You watch that again in Italy, in Korea, right? I just look at the numbers, right? About 3 weeks ago, February 22nd, the infected patients in Italy is about 79 people. Right now it's already over 10,000 people. This is less than 3 weeks ago. In Korea, it's about 50 people. Right now it's about 7,500 people. So the how fast this disease spread, right? It's beyond anyone's imagination. It's infection disease, right? If you don't put any preventive measure, the number will just exponentially grow. It's just a basic science, right? My request actually. Well, I'm actually asking more than what they are asking. I was hoping like the government actually kind of shutting down all the schools, public gathering immediately. That didn't happen, right? Today, actually, I called the governor's office yesterday to voice my complaint. He's been on vacation, so I will try to call his office again tomorrow. Try my luck. Okay. I know that's that's actually beyond our town's decision, beyond the school decision. That's really a state level decision. My second request actually echo many parents is really give the kids all the parents or the entire community a choice, right? If they want to keep the kids at home, give them the choice. I know that Dr. Hackett sent a newsletter. Just one thing I want to, I cannot disagree, right? I want to just bring it out, but I know you have a lot of responsibility. You're doing best, you're collecting all the best information you can, right? But one thing I personally disagree is you compare this with H1N1. You practice in the policy is kind of what we have been following in the H1N1. I recommend Dr. Hector can talk to the Lexington Public Health Department. There's plenty data in the CDC. I don't want to repeat here. This is much, much worse than the H1N1. Especially the other than death rate, all those things, right? What we witness is the people have the serious condition being hospitalized. That's actually over 15 to 20%. Compared to seasonal flu, H1N1, that's 1%. That's what you see why the hospital got overwhelmed. So I think that's following that one is might not lead to the right conclusion. So that's only my little feedback. And but what I'm asking a little more is for kids going stay at home. I know school has been working on the e-learning programs, right? And see if we can accelerate that. And for kids stay at home, give them the opportunity also still keep up with all the school learning, school work. Yeah, that's my feedback.
Thank you. Thank you. Thanks so much. Please come to the microphone.
Hi, how are you? Good night, ladies and gentlemen. I would like to just briefly.
What is your name and address first, please?
Yeah, sorry. My name is Zhihua Zhao. I live in 32 Lawrence Lane, Lexington. Yeah, I have 2 kids. So one in the high school, one in the Bowman Elementary School. Yeah. So I want to bring a couple of points briefly. So first, I agree that as an educator, so your greatest responsibility or professionalism is to keep your school running. But this is not this is an exception when facing virus. I think as a school administrator, I think our management, I think at this moment, the greatest or the biggest courage or responsibility is to protect our kids rather than let it running. So I think one of the greatest achievement when facing such a dangerous virus is that you will be proudly announce that no kids in Lexington High School, Lexington Public School system are or will be infected by the virus, rather than you keep running this school and wait to the last moment. At that moment, already many kids have been proved to be tested positive, and at that moment you shut down the school. It will be too late. It will be just tragedy. So I think as an educator, the biggest accomplishment will be for you guys is to keep all students and all staffs, all teachers safe. That's the first point. Second, school is a perfect place for the virus to spread. No need to say that in, say, Lexington High School, there are like maybe nearly 3,000 staffs and students. And so each person has to keep a very short distance within each other. While according to many studies and according to the guideline by Princeton University, so people should keep a safe distance, which is 6 feet. But think about it. In public schools, no school can do that. So if you know this fact, while still keep the school opening and keep running and keep keep the student in the dangerous place. So I don't know what to say. You know the fact, and I am telling you again, that is the fact, that is the danger. And third, so from the process, from the development at New York City and Boston, we can tell that the whole process going so fast, like viral, so that we have no luxury, we cannot afford to act only after we get proved cases. I will have to say that at that moment that you get proved data, approved cases, that will be too late. So one more time, I'm here to urge all the school administrators, school management, to consider that. So at this moment, so we cannot make decision based on hard fact, but we have to make decision by precaution and based on prediction, okay? So fortunately, we haven't got any proved positive cases, but I think it's time to act rather than wait. Thank you. Bye-bye.
Thank you. Thank you for everyone who's come and taken the time to come to make a comment. Oh, I don't think. Oh, yes, absolutely. I didn't. Yeah.
Sorry, this is my first meeting. I should have taken more time because I didn't expect it to be so formal. It's kind of intimidating to use a microphone. I thought it's just everybody sitting around a table and talk about it. That's probably why I didn't stand up.
Could you let us know who you are,
my name
please?
is Hong Mei Zhang. I live 21 North Street. So thank you for giving me the opportunity, Dr. Hackett. First of all, I hope that by now you wouldn't think Chinese parents are crazy. All of us trying to stand here and say something, I think the only reason, I don't know, I know only one parent here. The reason I come up today is because today, one last straw in my mind, my daughter has been going to school. She's a 9th grader. But today I had the last straw. I just learned this afternoon at 3 p.m. an alumni, she lost both of her parents in Beijing. And she's a U.S. citizen. She came back. She kept that as a secret because she couldn't talk about it until today. I was talking to her about Massachusetts and Boston and Milwaukee, and then she's like, take some action, please. So I thought I would just come here to share with you. I think the reason, we are not good public speakers, and we might appear very crazy. However, a lot of us are actually have advanced education. I have a PhD myself. I look at facts, and I don't stand up and just stand up to talk. I think there's a real concern because we are a group of parents who are so much closer to this virus. We have loved ones in China, and we are not firsthand, we are probably secondhand. But all of the cases we have heard so far are quite intimidating. I want to say that this is not a flu. And I also want to say that after I read Dr. Hankert's the revised update today, you made a comment about, you mentioned that in your letter you were following the protocol we were following during SARS. But we know, we have a lot of experts in China, we know that this is far more serious then SARS, period. China is taking so much step, not because Chinese are crazy, it's because this disease is so much more contagious. And from the Biogen meeting, I think that's a very definite proof that this is not something we can take it very lightly. So I urge Dr. Hackett and the school committee to please consider our, I don't know the word to put it, but please let us keep our kids at home without penalty. Please give us the option to have excused absence for them. I hope we are all acting crazy today because we don't want the result to show that we are true. We don't want to prove right. But all the evidence are pointing toward we have to take some action. Thank you.
Thank you. No one else? And in no way does anyone think that people are crazy about this, because this is a very serious thing, and I think your story is a proof of that. It really touches home, so thank you for sharing that. Ms. Roy.
I'm afraid to be near this mic. I'm afraid to be near any mic, but I actually will reserve my comments on behalf of SPED parents after hearing from the school committee, but I did want to say something as a resident. I really appreciate all of these parents coming out and to express what people across multiple demographics in this town are feeling. And for anyone who thinks it's just Chinese parents, it's not. Anybody who's on Facebook, anybody who's in town knows that it's not. And I really wanted to thank this community, the people who came out here and took the time and trouble to express this. So thank you.
Yes, thank you for that point, because those of us who are hearing from people throughout the community certainly recognize that, and in no way would we think this is isolated to one community or one subgroup. Although I think, as many of the speakers have said, there is a different experience that members of our Chinese community are going through because of the connection of what they have learned about happening in China, as well as other experiences. I think there is a different kind of a deeper concern because of that, but that does not mean you're crazy by any means. Ms. May.
I think I came up with 3 questions that popped up in my mind while the parents were sharing their experiences, and I'm not trying to side with either side, by the way. As for like the virus, I would be most concerned with the kids with lower and suppressed immune systems who do currently attend school, because they are more at risk than someone who is a healthy individual. And maybe this is too logistical, but with closing of all schools, that would mean that all kids stay at home, and assuming that there is online education, and that does happen, not all the companies or like work at Massachusetts are like shut down, so that would mean parents still go to work. And so I would assume that high schoolers are responsible enough to stay at home alone and do homework, but I would be concerned mostly about elementary school students and maybe middle school students who don't have, I guess, the motivation or the responsibility to stay home and just do homework alone. And then lastly, I pulled up the handbook because I was trying to refresh my memory on the N policy, or excused and unexcused absences. And it's to my knowledge that excused absences still count towards the N policy. And so I don't see a difference it would make for a parent to sign their child out for concerns about the coronavirus versus if they signed their child out if they were sick. Like if they were both excused absences and they would still count towards ends, I don't see the difference. Those are just...
Thanks, good point. You're right, that there is not a distinction. It's the number of absences. Well, I think it might be time that we move to our discussion of this. There'll be another opportunity for public comment coming up after that. But I'm glad you reminded us of that. I was certainly aware of the number of ends and how it contributes to, and what the policy is. I'd forgotten that that's true of excused versus non-excused. I'm guessing, though, that what people are looking for in spirit is something that would allow for, no penalty. So you're right. I mean, under our current policy, it turns out that if somebody was absent for more than 5 days in a term, if that doesn't happen more than in one term, that end is erased. But if it happens in 2 terms, then it would become part of the transcript. So I think that's the concern. So now I'm going to ask if Dr. Hackett might just give us an update on the status. I mean, we know this is a situation. It's changing every day. And why don't we start by giving your report of where things stand now, what's being done, what's being anticipated, and how you're working with some of the public health officials and the town municipal side around this issue.
Okay. Would it be okay with you, Madam Chair, if I addressed some of what we just heard?
Absolutely, yes. And I hope then yes, I would welcome that if you feel, whatever you feel prepared to discuss, and then it may be then something that we can all talk about together. So yes, definitely.
Okay. If you'll bear with me, I took like all kinds of hen scratching type notes, so I'm going to probably meander, but I do want to try to address what you raised as concerns, and I do think it's very important for you to leave this meeting knowing that you are heard and listened to, and I felt a lot of pain and heartache in the room, and I know that there are tragedies that you are all witnessing through your loved ones or with your loved ones and firsthand in some cases, and I think for this community, it's an important reminder that people's experience with coronavirus 19 is very different, and we have different ways that we're processing the information, and I feel for you, and I thank you for sharing your stories. I know it's not easy. We definitely don't think you're crazy. We think you have things to worry about, and I want to kind of go through each point and speak a little bit about what I heard. I also want to start because my heart goes out to you and your families and your loved ones, and my heart goes out to the Bowman family. I keep thinking with every communication, there's a person out there, a family and children, and we talk about it like it's a case, a number, just a dot of sorts. But these are real people who have real feelings, and it must be awful what they're going through. So I want to send them the Lexington Public Schools family love, just as I do with all of you, and just know that we are with everybody in this process. And somebody said, I think you said right in the beginning, I think you said you must be more worried because you have all these kids and we just have our kids. And then somebody said we're all in this together. And I think we all equally care about every child, and that's why you're here tonight. So that's really important. I definitely care, but we all care, and we're trying to get through this in a way that makes the most sense and to keep people safe. Let's see. I think I want to say that the comments around what it feels like when you're a parent with children and you're rational, you know the statistics, you cite the statistics, you're data analysts in some cases. So I think somebody said 0 to 9, the death rate is 0%. 9 to teens, it's 0.something%, and then it goes up dramatically. And so we've heard, I think my inbox is probably at 454 the last time I checked, and it's not because I'm not answering people, it's just because we're a little bit busy these days. But one of the common concerns that I've heard expressed is about whether children can be carriers and bring it home to family who may be compromised, is what people are asking. So worried about elderly family members who are at home, and we've heard that concern, through many different places. I do want to say, in that case, if you have a unique and special circumstance where you have older parents or grandparents or other family members living with you and you're very nervous, talk to us and let's see if we can help you if your situation's unique. I'm going to go through my letter, which is going to have answers to some of your questions that you won't like. Some of you have read it. It's not going to be a shock to you, but I'll try to explain. I think face-to-face explanation is always a little bit easier. I'll try to explain the thinking and the logic. But when I go through that letter, I want to say that there are flexibilities that are in place, so we can't possibly understand every unique situation that exists in Lexington, but we can listen, and you can tell us what you're experiencing, and if there's a way that we can give you what you're asking for, we can try to work on that. We also have to balance that with the needs, first of all, the demands that are placed upon us at the state level, and then the fact that in some cases people are asking for exceptions, not for the same reasons that the people here expressed tonight. They want to stay home, or to Sarah May's point, there's a lot of concern that if we were to close school, if we were to excuse absences, where would children go? I can tell somebody was really firm, said, I will be a good mom and I will make sure that, and I believe that is true. And I believe that most of our parents are that exact same way. I know some other communities have experienced that children are maybe going to Starbucks or maybe going to different locations. And I think your point was just so well articulated. You really do a great job about, we're and I don't mean this in a pejorative way, daycare for many people who are working and they need somebody to watch their children. So even with a snow day cancellation, I worry about that always because we're putting great burden on families in that way. So there are many considerations. Some even ask if schools release and we cancel, will it be more harmful to families because they're not in a contained area? I'm going to go through our cleaning protocols and talk about what we've done to sanitize. And I have to say, as a superintendent who is now just in her second year, these protocols were in place before I got here, and they are outstanding. So we have people in this town, not just on the school side, who really understand what they're dealing with in terms of this virus. And we have protections in place that make us feel like school may be a safer location than other locations that aren't treated. So people, we know what the environment is. We know if we cleaned it well. You don't know what the environment is if you go to the mall, the movies, the grocery store. So we're taking all of that into consideration. Somebody mentioned emergency plans, and I've had many conversations with the local Board of Health, with town officials, and we had a meeting, in fact, last night, and actually I had a written statement last night that changed by morning, so this tells you how things are rapidly evolving. But in that meeting, there was discussion and follow-up, by the way, by the Board of Health around emergency planning. So ensuring that every department in the town, not just the schools, have a plan in place for what would happen with the spread of the virus. And Dr. Lyons, if you can just give a wave. So Dr. Lyons is Assistant Superintendent for Curriculum and Instruction. And a couple weeks ago, when I forget which update and memo it was, I tasked Dr. Lyons and her team in the curriculum area to look into remote learning, which is the online learning platforms. And we do already, somebody offered resources, which was so generous of you. And we've had really great outreach by our whole Lexington community saying, how can we help? What can we get you? Do you need cleaning supplies? What can we do for you? And it's just been terrific. So what we have talked about is, and what we're working on, and what we will be able to share with you very soon, we're not quite there yet, but very soon, is a plan for what it would look like and what platforms we would use. And from the school standpoint, we have to talk to our educators, our union officials. We have to get input from people before we roll it out, and talk about what it would look like, what people's responsibilities would be, and under what conditions a plan like that would be implemented. So that was a piece of information I thought was important. Italy was mentioned. I forget who mentioned it. You mentioned Italy. Thank you. And Italy was a tricky situation. So many communities had people going to Europe during the February break. Ours was one of them. And the students left around February 14th and then returned shortly thereafter. Italy, when children left, or when students left at the high school level, students and staff, was not at geographic risk. So if you've been following, and I'm sure all of you have, the CDC travel updates about countries that are at geographic risk. We had China, Iran. These were the level 3 areas that the CDC said do not travel if you can help it. They didn't say you can't travel. They said non-essential travelers should stay home, basically, from those areas. So China, Iran, Italy got on the list, I think it was February 29th, so people were already back by the time we got the information. Kids had already returned to school. So that, as I said, we hear this a lot with the virus, things are rapidly changing. That was a good example of kind of things moving very quickly, and then trying to figure out how to respond in that particular case. So I think Hong Kong, the last time I looked, Hong Kong was a level 1, Japan was a level 1, and those haven't changed so far, which is at least somewhat hopeful news. We haven't seen the geographic areas at risk rise up to higher levels yet, anyway. And we're also, I should say, under no pretense about what's happening and what could happen, and certainly prepared to see cases if that happens to go that way. We know that there's a presumptive positive case in a child in a neighboring community, and those are really difficult situations and constantly monitored. I also want to say a little bit about attendance and absence. I'm going to go through the letter. It is tricky. Somebody said it was under my authority. It certainly is under my authority to excuse or unexcuse. Sometimes I think I should just kind of move aside and let Sarah May come sit right here, because her answer was right on the money. And so if you are worried, somebody said, my child's going to get punished. Your child is not going to get punished. If you are worried, if you're fearful about not sending your child to school, and you feel like it's best to keep your child home, the penalty as it stands right now, if it's even a penalty, and I understand that there are different feelings about this because you have college applications pending and things of that nature, is exactly as Sarah described. So if you say your child is sick, it's marked. You want to say it again?
I don't think I meant it that way, just to say that you're sick, but I meant it as if you were to excuse your child from school for fears of the coronavirus, and you were to if you were to change the policy and make it excused, it would be the same as if you were to have a sick day, and that's excused. So it wouldn't make a change in the end policy.
What matters is the number of days.
Yeah.
The total number. Okay, we're going to have to refine that a bit. But, I mean, the point is that it's a record-keeping exercise that we have to give to the Department of Elementary and Secondary Education. People put a lot of weight into that record-keeping exercise. And I guess I'm saying that you need, as parents and as family members, to use your judgment about that. And we've tried to communicate in all of the updates that we're treating this with flexibility, At the same time, we have to have a system in place. So I'm going to describe that system to you in a bit that talks about how we're thinking about this at this date and time. The other piece of information I should mention is because things change so rapidly that you could very well have an update from me soon that says something else. So I sent an update today at 2 p.m. around there, and then by, I think I wrote it at 4:58 p.m., the second update, already information had changed. So whatever I say now, just know that it's for this moment in time and that things could change. I was going to say, don't hold me to it. That sounds terrible. Hold me to it for a while until you hear differently. Let's see. I thought it was a really terrific point about Lexington is different. I think Jay, am I saying that correctly? You made the point about we're in a different community, and we have people in this community who have a vast knowledge of expertise around biotech and know about healthcare and how systems work, and to listen to the community is something that we are doing all the time, and I think our local public health officials are doing. I know they are because I'm in those meetings with them. I left a meeting last night with the Board of Health that ended at about say 6:30 when I finally left the building. At 6:30 a.m. they were on email with me again. So we're just in constant contact, and we are talking about the things that community members raise and help educate and bring awareness to us. Just making sure I got all the points listed out, and I'm sure I'm going to be missing something, but I'm going to work through it and make sure that we don't miss anything. Oh, I know what I wanted to say. So the question or the comment around H1N1 and don't compare that to coronavirus 19, I appreciate, and because I'm not a public health official, I want to tell you what I was intending to communicate when I added that sentence, but now that you've shared with me the concern, I'll go back and modify the sentence. I listed it under excused and unexcused absences, not as a comparison to the coronavirus 19 or COVID-19, but as a way of thinking about how the state organizes its policies. So I was in Brookline at the time in 2009, and H1N1, which is not like COVID-19, was very different to these communities. We weren't quite sure how to deal with it. People were asking the same questions. I agree that this is much more serious, and we have to treat it very seriously. But in Massachusetts, people were asking the same questions, and we were having daily briefings. People were saying exactly what you're saying about attendance and excused absences and closure of schools. I remember it well. So we had daily briefings, and then they put us on a speakerphone with officials from the state. And we waited until we heard from the state public health officials to implement, excused absences. There was a point at which attendance started dropping in areas. Some of our teachers weren't showing up. It was clear that something needed to be done, and then policies were implemented to excuse absences, some closures of schools, some days off, and things of that nature. So I use it only as an example for dealing with the excused, unexcused absences, not a comparison to COVID-19 in any kind of way. I am sure I'm missing things that I wanted to say, but I think what I'm going to do now is I'm going to go through the letter and give you all the most up-to-date information as best I can. And I want to say to all people who spoke and offered your comments, I know it's hard to do that, and I think you're very brave, and we do seem formal and formidable at times, but we're not. It just looks more official than it is. We have duties and tasks. Ms. J has things that she has to keep going in order, so state your name, state your address is part of the part of the process, but you all did a really terrific job and you really moved us, so I thank you for that. So I'll go through the letter and information if it's okay with everybody, and as I said, this modifies all the time. One of the things I like most about Google, I had, not spent a lot of time on it, to be honest, before coming to Lexington, but what's really nice is that we can make adjustments if need be so that we can correct the record with things like the H1N1 concern. So I sent a communication out, and I haven't even had a chance to debrief you on the communication. It's been a busy couple of days. I sent the communication out this morning because we had a Boston Symphony Orchestra gathering of students that was supposed to happen tomorrow morning, and then again, I believe on Friday, Thursday or Friday? Okay, so we had 2 days in Massachusetts. 1,000 kids would be gathering at the Boston Symphony Orchestra, and the question was, will we be taking the field trip? And time was of the essence. We also had some town events that people were asking about that were happening at 4, so we kept I wrote one communication, I wrote another communication, kind of not knowing what the direction was going to be with the Board of Health. And what I also want people to understand is it's not a matter of writing the letter. So when I talk to the administrative team, we talk a lot about the communication and having one voice and writing, with one message. The reason that's so important is because things that I say influence other things that are happening in the town, or on the municipal side. So if I make a decision on the school side, that has a ripple effect for the municipality. So we want to be in sync with that. And what that means is everything that I have written from the start, which is January 28th, I think, which was my first update, has been run by local public health officials. And I feel good about that because we've built a good, strong collaboration in that way. So it was time to sort of answer people's questions about whether we were going to have large group gatherings. That was the number one question we were getting, and I know you get a ton of questions too. So I talk about how many I get, you never talk about how many you get, but you get a ton too. So I appreciate your support in that way. And then there was supposed to be a conference call at 2 p.m., or a press conference, I should say, at 2 p.m. It got delayed. Principals were being inundated with questions from parents, educators. We weren't sure if it was going to be delayed again, so I just told the Board of Health and the town manager through our collaboration that I feel like I need to make a decision. I feel like it can't wait because the buses have to roll tomorrow or not, and people need to know. So drafted the communication, sent out the communication, and the communication I sent implemented a practice that I gave an end date of March 15th at the time. That changed after the governor's press conference. And also, I mentioned in the first communication that as of the time that I wrote it on the Mass Department of Public Health website, and I kept checking, there was no guidance on public events. So they said no school cancellations are recommended. So nothing had changed from, a communication standpoint, and somebody raised how difficult it is to kind of work through these bureaucratic processes and get guidance as local public school officials. And I would agree wholeheartedly that has been a challenge, but I know everybody's doing their best, and this is new territory, as someone pointed out earlier today, for all of us. So I wrote a new communication after sending that one out, which I started to revise the actual one that I wrote, and we realized that's not a good idea because people will get really confused. So instead I wrote another communication, and the most recent communication that people should look for, you don't have to worry about the one that was previous, although we kept it as a record, is the March 10th, 2020 update, and it says updated as of 4:56 p.m. So this is my last communication so far. I'll probably do a few more, I'm sure. And in it, in my previous communication, I said that the risk to Massachusetts residents remains low. I heard the gentleman who spoke about, I think, did he go? He did a very nice job. I think he mentioned that, and he said, he talked about if I'm pronouncing that correctly, I hope I am, and said that he believes that the risk remains low. So I had that in my previous communication, and then people said, wait a second, the governor declared an emergency, state of emergency. So in the second one, it's updated. It was correct as of the time that I wrote it, and it's updated to reflect Governor Baker's declaration of a state emergency at approximately 4 p.m. today. The Lexington Board of Health subsequently sent a communication out right after, which I embedded in the letter that I sent most recently. And the Lexington Board of Health has asked me to reiterate these points, and I think they echo what has been stated in this room. And there are two big points that they wanted me to emphasize. One is that COVID-19 is most dangerous to the health of the most vulnerable in our communities, including our elders and people over the age of 60, people with compromised immune systems, people with pre-existing diseases, and others with health vulnerabilities. So that's important for us all to know. And also, the Board of Health is suggesting that our community limit the potential for infection to these people by increasing hand washing, visitation and social gatherings when interacting, so kind of using separation. We recognize that there will be contact. Our strategy is to limit this contact where possible. And you'll see that in the Board of Health's update as well. I mentioned in my communication, because I think it's important, and hopefully you do know this, that I am a mother, I am a daughter, I am a superintendent. I have worries that you have and feel those worries very heavily. It's an unsettling time for many of us, and we understand your concerns, and we're going to continue to respond in as timely a manner as we can. The information in the paragraph that follows, saying the coronavirus disease is caused by SARS-CoV-2 virus, is a Board of Health information that was included. And then I mentioned, as some of you did as well, that it continues to spread in other countries and in the United States, prompting higher education institutions to cancel or limit group gatherings in order to minimize potential exposures to people. So we're reading about Harvard, and we're reading about MIT and UMass Amherst and Ohio State, I think I saw, in other places. Many people are making contingency plans that they're implementing. Actually, it's not a contingency plan, they're implementing now. So when we had no announcement, and with the full support of our local public health officials, because this relationship between the schools and the local public health officials, we want to keep intact, and we want to make sure that we have all of the information that we can. When I made the decision to limit large group gatherings before the public health announcements went out by the proper agencies, they were very supportive. And we worked together, and I felt good about it because it had their endorsement. So I made the decision earlier in the day to limit all large group activities. Governor Baker's emergency declaration urges the public to avoid all out-of-state and international trips and to limit large group gatherings. So, effective immediately, all Lexington public schools, school-sponsored out-of-state and international travel is canceled indefinitely. I put an end date on my previous communication. I don't know the end date now. And all in-person events with more than 150 attendees are indefinitely postponed or canceled. And then I've listed a few acceptable alternatives that we've talked about. So this was a really hard time to cancel these events, because we had people who, young people with their hopes up about performances and so forth. Obviously, if you tell a child that they don't get to go on their field trip, that's a bummer, but we have to do what's right in terms of safety. So alternatives to what I just described with large group could be that you break into smaller groups. Somebody mentioned the number 25 as being a limit for gatherings of that size. So, for example, we had an event planned with 600, 700 people coming up, and it was the showing of the video, I'm Not Racist, Am I? We were going to meet in the auditorium. That event can't happen as planned. But what they can do is they can break up into different rooms in smaller groups and do some learning together if that's the wish of the people who planned. And I believe, as last I knew before I came into the meeting, that's what they were thinking about doing. And the other option is the virtual format. And the virtual format is something we're going to exercise at the community forum that's coming up this week. So we worked with the Board of Health because we felt like this communication was missing. Just exactly what you did tonight is what we were hoping for, more interaction, so people could really have their voices heard, really tell their stories and educate us in many ways. So we arranged to have the forum from 6 to 7:30, I think, on Thursday night. These are my date checkers. I always get those wrong. And we have panelists who can talk about cleaning and sanitization protocols. We have Hua Wang from Cal, who is going to join the panel to talk probably about diversity and some of the discriminatory practices that people have been worried about that we tried to address in the communication. And I was pleased to hear your comments, Sarah, about students have been very supportive of students with face masks, and we are not perfect, and we have sometimes rare exception here and there, but I think that people have done a really terrific job of supporting one another. So anyway, we had a panel of local health officials. We had a doctor with students. We have a doctor with students in the system who's also on the Board of Health, Dr. Geller, and a number of panelists, myself included, who are scheduled to talk to the public on Thursday. And then people immediately wrote in about how is it that you're organizing a community gathering. So if you go back in time, Mass Department of Public Health wasn't advising anything. Governor hadn't spoken about anything. People were continuing with their plans. So we said, let's just monitor and we'll adjust if we needed to. So obviously, if we are co-sponsoring the panel as a Lexington Public Schools organization, that means that the panel can't go on under the conditions that I've specified in the letter. And I'll talk a little bit about those conditions. But what we will do is we'll have a virtual panel. So there will be no audience, is how I envision it. We have to talk to the communications expert or specialist, Sean Duggan, who does a terrific job for the town of Lexington. But I assume that we'll have our panelists. Mr. Malloy is going to be the moderator for the occasion, and we're just going to talk about hopefully the hard questions that you all want to know about and share what we know and what we're thinking at this point in time as one more source of information. What I've learned through this process is I pour through this very lengthy document. They all tend to be lengthy, and they are here because people really want to know the details. So we try to provide as much information as we can, but what we don't always get the opportunity to do is to talk about this, and I think that's what's most helpful. So I'll try to not talk too much longer, so I'll try to get through this but give you the highlights. So once again, effective immediately, all Lexington Public Schools school-sponsored out-of-state and international travel is canceled indefinitely, and all in-person events with more than 150 attendees are indefinitely postponed or canceled. The out-of-state travel and the international travel, we had no trips scheduled for April because that was the CDC advice a while ago. So no international trips. We had one Quebec trip in May. And then we have a number of out-of-state travel trips. And actually, Dr. Lyons, did you bring along the list? I have a partial list. Okay, so we can get that out later. But the we have just several trips. Those won't happen unless something changes and we hear otherwise. And we're taking Governor Baker's advice seriously, and those are postponed indefinitely. I'll tell you if it changes. Let's see. I also mentioned in the report that, or in the revised coronavirus update number 6, that I may further restore or restrict public school events. So if we hear things are getting better, it'd be lovely to be able to restore and limit restrictions. If we hear things a need to have more attention and we need more focus, and we're going to work with our local public health officials and community to determine that, then we will further restrict. So we may say the 150 limit that we've imposed no longer works, and we're going to think differently about that. And if and when anything changes, as always, we've written a number of updates. We'll send those to you. They can also be found on our homepage. We are translating all documents, so you'll have access to that. At the Board of Health meeting the other day, we talked about the importance of redundancy and communication, because the question was, where should it reside? Should it just be on the town website? I feel strongly people were receptive to this, that it needs to be in both places. If people looked on the school department website and did not see the information, that would not be very comforting to people who are worried and want resources. And I want to say a little bit about why 150. So basically, we're following the MIT protocol, and they identified the threshold of 150 for this reason, and I'll just borrow a quote from them. We chose 150 people as a threshold to help reduce risk of transmission without calling a halt to all activity on campus. However, group size is only one factor to consider in planning an event, and our success in managing the risk of COVID-19 depends not only on the existence of these policies, but on your cooperation and common sense. So there are guidelines, but you also have to apply common sense, and we've issued some guidance that we borrowed from them and credit them with. And that's the protocol we're going to follow around large group gatherings. Parent Academy, so yes, I do have a particular answer on Parent Academy. Immediately after we sent the guidance, we got lots of questions, including, I have a text thread with 20 administrators who wanted to know answers to the questions, which is useful because we know what we have to think about. Parent Academy, what we have said is that if you cannot control the size of the gathering, you can't have the gathering. So, for example, we had students from the high school who were going to Boston for a choral event. We don't know how many people will be in Boston, so we can't reasonably say that there will only be a crowd of 150. If you have, and I don't know enough about this to be able to answer the question on Parent Academy, if maybe Sarah does because you worked on it last year, if there's a parent sign up and it's pretty clear what the numbers will be, that could be a different matter.
So they do a lot of the sign-ups beforehand through the rec department, but they do accept day of registration, and we always have walk-ins. So I think that given past experience, it is likely for people to just show up that day.
In that case, if that were coming to me, which it will be soon, I would say, no, we won't hold that event. I have lots more to cover here. I will try to do it quickly because I know I've been talking a long time, or would you prefer that I stop?
No, I think it's important that you cover all the points.
Okay, I'm going to keep going in that case with cleaning and sanitization protocols and supplies. So in previous updates, we've given you some background. People were interested in more detail, so we've given even the more technical aspects of our cleaning protocols. As I mentioned earlier, we have really outstanding protocols that have been in place in the town of Lexington for a long time. We have 2 products that are used. I think they call them PC 103 and PC 105, and there are technical names, and we know now more about product than we ever used to. In the document that I've given, I have added hyperlinks to the technology guidelines for sanitization. We're getting lots of questions about that. And then as well, the custodian's detailed or Department of Facilities detailed memo about the product they use for people who are interested, along with the custodian's handbook. You don't typically see that, and there are some very clear guidelines about how the daily cleaning happens. I think what I want people to know most of all is that, first of all, we have checklists in place around cleaning, and we also have unannounced visits. So the people in the facilities department will check on custodians to see if they're following the new protocols, which include cleaning the hard surfaces, and we clean with the 103 and the 105, which are specifically designed to fight not just coronavirus, because some of the materials will just say coronavirus, but COVID-19. So it says on the product. And the way it's been described to me is we have an electrostatic fogging machine if we need. So everyday cleaning happens with 103 and 105, depending on the location we're talking about. So all the desks get cleaned, all the rooms get cleaned. If we have a special situation where we need a deep cleaning and there's concern, perhaps it would be around, let's say, a presumptive positive case that was actually in the school system, because remember, we still do not have any presumptive positive cases in our schools. We have a family member who is presumptive positive of one of our students. If that were to occur, we have an electrostatic fogging machine that disseminates the chemical that fights COVID-19. So that is a little bit more of a intense clean, and how they've described it to us, and Dave, you were at the safety meeting too, so if you want to chime in, feel free. But how they described it to us is it leaves a mist over everything in a room, and then it wraps around even the edges of the materials. Oh, Chris, I'm sorry I left you out, Dr. Lyons. You were in the same meeting too as well. And I want to talk about Bowman for a minute with respect to that. So immediately when we found out about the Bowman issue, we had some extra cleaning protocols in place. I also want the school committee to know that our Bowman students and families and staff are amazing. And I went there first thing in the morning on Monday. We were on the phone trying to problem solve on Sunday, as you know, with the Board of Health. And on Monday, I visited every classroom and every office so that people wouldn't worry that I was going to one particular location or another, checked in with educators and students, and I actually have one more tweet that I haven't had a chance to tweet, but I saw, let's see, rhyming, spelling, algebraic equations, all kinds of fun and games, comparison and contrast. Two young people worked up a Venn diagram, and they made it into a butterfly, and they wrote some lovely words, and they were proud of their creative new Venn diagram. But anyway, just great teaching happening all the way around, and kids learning. I walked into one classroom and they were washing their hands. Somebody mentioned the hand washing protocols. Posters were up. Kids were doing it the right way. And it was just really good to see. I also returned this morning because staff had a lot of questions. So I went to the staff meeting first thing this morning and was able to hear concerns and talk through the questions. And that was also very good. So things are going well at Bowman. I know we have one Bowman parent who expressed concern. Can't see where he is now. And I shouldn't say but, and I appreciate the concerns that were expressed. I think our attendance was about 20% down at Bowman on the return day, just so you're aware of that, and 80% attendance in session. And let's see, I've talked about chemicals, I've talked about the supervisory checks. I also want to mention, I haven't mentioned Karen Rufo, who's our Director of Student Health Services in Lexington. She has just been phenomenal, and she and Dave Nealon, who work for the town, he is the public health nurse. They are a really great team and have done just terrific work together, along with our Director of Public Health and our Board of Health and the chair, and Carol Kowalski, and I'm sure I'm missing somebody, but everybody who's been a part of this, it's been really good to deal with, a good partnership. I won't talk about quarantine because I've already talked about that, and I heard that people understand that by regulation it has to happen with somebody else. Excused and unexcused absences. So here's what I have so far. As we await more guidance, we got some guidance today from the Department of Elementary and Secondary Education. We got some guidance from Governor Baker. We're still awaiting more guidance, but what we know so far is that the Centers for Disease Control and Prevention issued a communication on March 4th indicating that travelers returning from China, Italy, South Korea, and Iran should stay home and monitor their health for 14 days upon return to the United States. Then I said, Lexington Public Schools will excuse all absences that are the result of directives from the CDC, the Mass Department of Public Health, the Lexington Office of Public Health, and the Lexington Board of Health. So in other words, if you are asked to remain home, those absences are excused. The Lexington Public, by any of those organizations, CDC, Mass Department of Public Health, and so on. The Lexington Public Schools Administration is working to ensure that students who are not sick are not kept home unnecessarily. So this is a tough one because this is where kind of the subjectivity comes in, and what is happening is that in many cases children are healthy, and I realize that some parents would like children to be home, other parents would like them to be in school. Our job as public school educators is to make sure kids get an education. So what we want to do is have children in school until such time as the Board of Health or the Mass Department of Public Health or the CDC tells us that it's unsafe, and so far that has not happened. So if students are not sick, their absences will be recorded as unexcused. So if they're just kind of skipping school, essentially, they're unexcused, which is what happens today, right? And then this is where I wrote the part about H1N1, and again, that was not to compare COVID-19 to H1N1, but to say this was a protocol that was discussed, and it's the only similar thing that we have, to the best of my knowledge to this day, in terms of how we were able to handle this issue from a public school standpoint. Governor Baker indicated in the press conference that the Department of Elementary and Secondary Education is providing districts with flexibility. Some of you mentioned that here this evening. Information that would be most relevant, I think, to our school community relates to the number of days districts will be required to attend school this year. So this is actually good news, which creates flexibilities for parents, families, and for us. And what they have said, and typically there's no flexibility, just so you're aware, when we ask for a reprieve because of a series of bad weather days, the answer is make up your days. So they usually have a very hard line with this at the state level. But what they're saying now is that the longest that any school district will be required to go to school is its scheduled 185th day. No schools will be required to be in session after June 30th, 2020. So we're required to do 185 days. You don't have to go beyond that. And the 180 days, you don't have to go beyond that. The 180th day on our Lexington Public Schools calendar, which is hyperlinked to the letter that I wrote, is June 19th, 2020. So under the new guidance by the department, that means that the 185th day here would be June 26th. So essentially there's 5 days reprieve. So they're letting us off the hook potentially for an extra week should conditions warrant it. There was one more point I wanted to make about attendance, and now I do not see the point that I wanted to raise. Okay, it'll come back to me. I'll find it. And then lastly, looking at what would be the conditions under which I would consider a school closure, and I heard people in the audience say, please close now. And every time I hear that, my heart definitely does things that, I don't know, parents, mothers, people do when when you know that people are heartfelt in what they're trying to convey to you. The conditions under which I would do a school closure are not made lightly. Anytime I cancel school for the reasons that Sarah May described, it's not easy. Kids need supervision, they need food, they need, all of these kinds of things. We're more fortunate here in Lexington than even in other places, but it's still not an easy decision. Parents need people to look out for their children. If we were to consider closing a particular building, we would do so if a student or staff member is diagnosed with presumptive positive cases of COVID-19 and the potential exists for exposures to others. So I am not prepared to close school without directives by the Board of Health or the public health agencies. And I think that's important because right now we're dealing with this issue. I heard you say it's not as serious, and I agree with you. The H1N1 rather is not as serious as COVID-19. People, when I was in Brookline in 2009, who were talking about H1N1 felt it was as serious, and were asking for the same thing. So as a public school educator and not a public health official, I need to rely on the people who have expertise, and I also recognize that there's expertise in this community, and I think our Board of Health recognizes that as well and listens and is responsive. But if they were to say, we have a serious situation, we think it's spread to a degree that we need to elevate the level of concern, I would close immediately. And so far that hasn't existed. We haven't had that conversation. We would not consider school closure for people who choose to self-quarantine and are asymptomatic or show no signs of illness. We would consider district-wide closure. So I was just talking about school-to-school closure. We would consider district-wide closure if the Mass Department of Public Health or the Lexington Board of Health indicates that residents should limit contact due to COVID-19. So if they say we have, multiple schools who are facing issues, or there are multiple attendance issues among buildings and staff members, we would take a look at closing schools at the district level. And by the way, the online learning that we're focused on now deals with the types of closures that would be encouraged by the Board of Health and our local public health officials. So you can imagine if we were facing a situation where we had multiple school buildings and, many concerns in that way, then I may close school in the district. And then the good news is that we would be out still at the end of the year by June 26th. And the colleges, I think, are, you've seen how the timelines are working. They're doing the online learning. They only need to get to May 10th. I'm required under the law to get students to their 180th day. And we have those obligations to meet, and that puts us way to the end of June, which makes it, I think, all the more challenging for public school people. So I'll pause there because I'm sure there will be lots of questions. Or maybe not, maybe you're tired now.
No, yes, but okay, you know what? Why don't we hold public comments for our next community speak? Will be soon. I think what we want to do is to have a discussion. We wanted Dr. Hackett to present. I think our school committee colleagues would like to be able to comment as well. So first I want to say thank you for all the diligence you have put into every communication and the deep thought that's gone into every decision. We know it's not easy, but you have been really putting a lot of work into these continuous updates, and I think the community has recognized that you are trying to be as open and transparent about some of these issues. So thank you for that, and thank you for stepping us through that. So now I would like to open this up for school committee discussion, including our student representative, to respond either to some of the things that Dr. Hackett has presented, or other feelings you might have, or reactions to some of the things you've both seen and heard outside in the community, as well as this evening. So I'll just open it up to anyone who would like to make a comment. Thank you. Ms. Sani.
So this is just an initial comment. I may have something further later on. I just wanted to commend you, Dr. Hackett. I have seen you talk in small groups. I have seen you talk live on television. And you have been very thorough and very, you've explained yourself very well. And the numerous communications go a long way in just allaying people's worries. I also commend the people in the background who have been supporting you, the building heads and Dr. Lyons and Mr. Coelho, because there's a lot of work that happens in the background. This is really a very strange and difficult time for everybody, because even as you see, Charlie Baker is trying to figure out his message, and then he has to delay his news. I have a very quick thought, and that is, I know a lot of these decisions rest with you. What can the school committee do to help you? Because as the situation changes so quickly, is there some sort of the blanket approval to go ahead and inform us later, or should we have some mechanism that if you need any form of approvals, it can be got to you fast? What can we do to help you?
I honestly think what you do every day helps me tremendously, and you're all very flexible, including our newest member. I can count you among them. What happened the other day with getting messages out through social media was incredibly helpful, because some people don't get all of the message, or sometimes the message tells one side of a story, and it, I think, leaves our schools looking like perhaps we are unresponsive, or we don't know what we're doing, or we haven't communicated well. And I don't think that's mean-spirited. I think we are living in very uncertain times. We're dealing with a global health crisis. People are going to be concerned no matter what, and so we just have to, share as much information as possible. So you posting it to the social media platforms that you know about and frequent. I do Twitter because it's 140 characters or less, and if I had to read, all of those other things, I'm not sure how I would be able to do the daily job. And people do a nice job of keeping me informed, so I really appreciate that. In terms of needing kind of authorities or being granted authorities, I think I have what I need in place. So I know I can close schools if I need to. I know we have a strong and collaborative relationship with the Board of Health that is, it's amazing what happens under difficult circumstances in a very short period of time. People work together in ways that you didn't realize was possible, and we have that relationship now, so I'm grateful for that. And I think I have what I need, and you offer all the time, and I'm really grateful. And also, just to emphasize the point that you get tons and tons of inquiries, and you are constantly sort of feeding communication back. And we sort of take it for granted here. Like, it's just what you do when you're a Lexington School Committee member. That doesn't happen everywhere. People don't spend the kind of time in public service that you do. And I just am really grateful, and I know everybody is too. Right, Sarah? Right. Sarah says right.
Thank you. Ms. Cuthbertson, you have the microphone.
I just wanted to clarify about the Parent Academy, because what you said about the I'm not racist, am I, being okay, maybe if they do it in smaller groups. The Parent Academy is in small group sessions the entire day. There's no one large group, but people are moving all throughout the community center. So I think, you could talk to Julie Fenn about what the registration status is now. They typically do have walk-ins, but it's not hundreds of people. So if their registrations were low at this point, that might be something to discuss with her. So I wanted to clarify that just so yep.
You made me remember something I forgot to say. We have SATs this weekend at the high school. That's not funny, Helen. It is kind of funny. So we were trying to figure out, we have lots of kids coming to the high school to do their thing, and from different districts too, and typically they gather in one location, so hundreds of kids in one location, and then they break out into their small groups and rooms of 25 or so. So the high school's already working on making sure that people know they cannot do the group gathering, and they're to go directly to their location. So we're going to eliminate the large group and still be able to have the event in that way. So there are ways to work around that. The biggest issue is for anybody who has an event planned, you cannot have that communal gathering and then disperse. Also, we have 2 concerts this week. Jared Cassidy, because he is one in a million, has already reached out and indicated that he would like to, this hasn't been finalized, so I'll just say it as an example, but he would like to hold the concerts without the audience and televise, which is a lovely way for the kids to be able to still do what they've been working so hard at.
I was just going to say thank you. It has not been an easy week to be to jump right into school committee, but I know it hasn't been easy for you. And it's, I think it's made me feel a lot better that we're getting, you're keeping us in the loop because we are getting a lot of questions. So that's been really helpful. I appreciate it.
Mr. Boken.
First of all, I wanted to thank the people who spoke today. It was nice to see the honesty. I applaud you. Thank you for sharing. And also, in terms of what Dr. Hackett said about emails and things, we read everything that you send us. Don't think that we don't. Even though we might not be able to respond right away, we do read those, believe it. My question was about the remote learning plans in terms of, you mentioned in your, it was written down here, but you didn't address it to the group here, about the special education aspect of it. I know that's going to be tricky, and I know you've thought about it. Can you give us a little more ideas about how that's going to go down, if it does happen?
Yes, I can, and I can also invite Dr. Lyons to come up and talk a little bit about some of her work. Let me just pull that part. Oh, I still have a whole other report here, don't I?
That's right.
Oh, goodness. Okay, yes. And the special ed location is, help me with all this paperwork here. Okay, this is from a different update. That's why we haven't talked about this publicly. This was the previous update. The special ed administrators met to discuss support for our students in case the district closes for an extended period of time. The discussion focused on materials and supports that can be provided or accessed to assist with maintenance of skills. In many cases, families already have access to online and electronic resources that can be used to support their student at home. Topics of discussion included ways to support families in maintaining a structure to their students' day. This information came from the Director of Special Education, so I'm including it here in reading it for that reason. Topics of discussion included ways to support families in maintaining structure to the student's day, encouraged continued use of communication devices for those students to use them, and the special ed administrators will continue this discussion with their staff at the building level. So they're working this out more. I should have mentioned to you as well that in our building at central office, it's easy to like focus on the schools and forget that we also have a facility with people who work in it who are nervous about the same sorts of things. When I wrote the communication, I went to every department in the building and checked in with them, and everyone's been great about doing the same, but just to see what questions do you have? Do you have any concerns? One of those groups was the group of itinerant special education administrators, and they all happened to be convening in the location at the same time, so we were able to have really great conversations, and I just wanted you to know that we're trying as best we can to have a personal touch in this too, because it's a scary time for people. The biggest thing, in addition to what I said in terms of special education, that I want to reinforce, which is also not a message that I would love to be delivering, is that if we have emergency situations and emergency plans, some parents and families' expectation is that they'll get the same level of service that they have right now. That is just not going to be able to happen. It's an emergency for a reason. If we call it services like PT, OT, speech, by nature of what we're talking about, which demands seclusion and isolation, if we're talking about keeping everybody home, it's very unlikely to be the case that we would send people out into homes and communities. And so I know that that's not a popular message, but I feel like it's the truth, and we need and have an obligation to tell people that now. Dr. Lyons, would you like to say? Whoops, sorry.
No, that's okay. Well, can I actually jump in with a question, since we're on this topic, and maybe this can be part of what you address. I think when it comes to the special education population in particular, I think a lot of the things around academics and online learning, and even some of the supports you were talking about, yes, it may not be the same, but in the case of those students, sometimes that's not the most important thing to pay attention to. And sometimes there are individual students who that change in routine, that you're now not there with the supports that you have. You're now at home with, we don't even know who the caretaker would be. It's a very different situation. It's a very hard one, I would imagine, for some students to adapt to. And I guess I'm wondering if there are any, as you do the planning for that population, if there are any plans that the teams that know those students the best would be working on to somehow ease that situation for them.
Good evening. You go, and then I can, no, you go, and I'll layer in from the regular.
We are a good team, and she's terrific. What you just described is exactly what they're doing back at the building-based level. So making sure that we're approaching this one child at a time and understand the unique needs. And you raised really great points. It's really difficult for our students to transition, and especially our students with, who are the most vulnerable, or students with disabilities. So we are working to try to say, it's going to be difficult for us to provide the level of service people want, but at the same time, we know that there are things that we can do to help. And Dr. Lyons has been working with all teams to kind of sort this out. So take it away, Dr. Lyons.
Alrighty, I will be brief, but I'm happy to answer any questions. So just to reiterate a few things, this is an emergency, would be an emergency situation if we were to go to something along these lines of remote learning for everybody. The notion, I just want to reiterate what Dr. Hackett said, that the expectations for the same level of instruction that would happen face-to-face is obviously not going to be possible. Nothing replaces having a real-life teacher in front of you. But given all of that, I've been in touch with and spoken to all of the curriculum leaders, K through 12, had a conversation with Ellen Sagita so that we can try to coordinate with special ed, Robin Dowling Grant for ELL, and what we are aiming to do, and what we think we have done, is, also I should say, also spoken to Caitlin Hearn, who's helping to coordinate professional learning with Tom Martelloni and his DLCs. And our goal is to come up with a system, and we believe we have, that will be very manageable for teachers if this happens, and meaningful learning for students at the same time. So we're taking it back to the simplest possible common denominator of what's the easiest way to communicate with students. And in the case of students who are special ed, who have special ed services, or special ed teachers who work with them, and or ELL teachers, how to integrate those services online as well. The goal is we have a lot of online resources already available. We have a lot of literature that students access online. We have some online textbooks in many grade levels actually that students work with. In other cases, students have their own textbooks that they would be able to have with them. So as far as resources go, we are pretty squared away with that. We have one-to-one devices, as Dr. Hackett said, grades 3 through 12. We can work on how that works for the younger grade levels. In terms of little tiny logistics, like our kindergartners and our first graders do not have Gmail accounts. Everybody else does. We still communicate. That is a good thing, yes. Even in this case, it's a good thing. We still communicate with those families whenever needed. So we have a way to communicate with those students through their families. So we, by tomorrow, we will have that plan organized and ready to present. And we are going to have that presentation tomorrow, give us the opportunity to have people bang dents in it and see if there's anything that we haven't thought of yet that will help to make it even more streamlined. Okay. I should also say one last thing, expectations for teachers in terms of any professional learning that needs to be provided. That's what Caitlin Ahern has been doing, organizing with the DLCs and with Tom Martelloni, so that teachers are going to feel comfortable to be able to deliver this as well, and we'll give very clear expectations on what that delivery should look like.
Quick thing. And in addition to expectations, conversation with union leadership about what this looks like. So this is not here, you go do it. It is a conversation about how can we best do it with them in partnership. And what we've been trying to do is reach out with all of the communications as quickly as we can to our LEA president and our ALA president and other people who are in key leadership positions and can help work with the staff and help us communicate, which they do.
I'm assuming as you develop these online remote learning things, particularly if it's, an entire school is closed or district's closed, that you're trying as much as possible to tie it to existing curriculum, right? So you're going to use the same textbooks and have teachers kind of develop lessons or communications around that. Because I know some people think, oh, well, you go to online learning, there are all kinds of resources out there in the world for online learning that aren't necessarily tied to our curriculum. Can you go to Khan Academy and do those lessons? Is that I think people will think, well, is that an acceptable substitute for what we do in the schools if students can't be coming to school? I'm guessing from what you're describing, the schools want to keep that closely aligned with the curriculum and not say, oh, you can go off and learn this way, and that's a substitute for what we do.
100% correct. We are going to link it as much as possible to the curriculum that we are already doing. There's some instances where that won't work. Lab classes are not going to work remotely. Ceramics classes may not work very well remotely. But as far as the general basic core of what students are supposed to be learning and are expected to be learning, we're going to coordinate with that. It may require, in some cases, that units get done out of sync. I was talking to a couple of department heads today, and we were talking about a unit that's coming up that they're doing that would be much better led as a part of an in-class, everybody together discussion. So the possibility that might go out of sync and happen later on when we come back is considered as well. The other thing is we think we have a very strong plan. We don't know exactly how it will work until we try it, and we're going to be open to adjusting as we need to make it work as we go.
Thank you. Anything else on that? Ms. Linehan.
Yeah, it's important for everybody to understand that, of course, if public safety comes first, if this is what we have to do, it's what we have to do. But no matter what we do with online education, this is inferior to what we do every day in the school buildings. There is no way to provide the same level of education online as we do in school. Even if you just think about the high school, and I think some people think the high school is much more like college than it actually is, because these are still children. And high school is not just teachers lecturing, but even when teachers employ direct presentation like lectures, it is not where the teacher is just blindly blah talking and the students are passive vessels. It is a dynamic, interactive process where you are observing the students as you are speaking. You're observing their body language. You're noticing who's not paying attention. You're bringing them back into the fold. You're asking them questions. So there just is not a way to replicate this, no matter what Google or Zoom or anybody has come up with. There's a reason we educate children where it's teachers and students all in one place. So it's important for everybody to understand that. So it's not just that the lab sciences won't work or ceramics won't work. History class won't work as well. And that's just at the high school level. The further down you go, by the time you get to kindergarten and first graders, we have pre-literate students. Like, how is this going to work? And then you think about, what is the supervision going to be? Let's say you have a family that has a stay-at-home parent. Oh, great, the stay-at-home parent can supervise. Well, the stay-at-home parent probably isn't going to be very good at that, because that's not what they're trained. That's not how it works. So then you have a situation where, let's say, two parents who work outside the home, now they're working from home. Well, they're working. So my husband works from home occasionally. He's on conference calls. He's writing. Let me tell you, supervising a 7 or an 8-year-old or even a high school student, that's not going to work. So now we get to this situation where you have parents who cannot work from home. Maybe someone is a healthcare provider who I think are going to be very busy. They're a nurse, they're a doctor, maybe they're married to an electrician. You cannot remotely work from home as a nurse or a doctor or electrician or a million other things. So who's going to be supervising those children? So Juliet Kayyem, who is a national security expert, she's in the Boston area. She had a piece in, I think, the Atlantic, and she had she had a description that I think is worth reading. And she said, a municipal police chief in the Boston area recently urged me to imagine that a school district closed for even 3 weeks. Take just one child raised by a single parent who is a police officer. That child is home, so the parent must stay home. Other officers in the same patrol will be affected even if they don't have kids in the school. Shifts will change, non-essential functions will be put off, and the department will have less flexibility to respond to problems unrelated to the epidemic, even as, with more teens unsupervised, rates of car accidents and certain crimes could well increase. So this has a domino effect throughout the entire community once you close, which is why if we have to do it, we absolutely will, but like I said, those domino effects are incredibly detrimental to the entire community. And I just want to add something else that's not quite related to this, just a little plea. I am sure that there are many people in Lexington watching who, like me, now seem to have a lifetime supply of toilet paper and rice and beans in their basements. Now, when we're fortunate. Those of us who can do that, we are very fortunate that we have the resources to go out there and stockpile goods. There are many people who do not. And all of the steps we are taking to control this vice have the potential to utterly devastate the economy. I mean, I'm from Las Vegas. Let me tell you, it is going to be a depression in Las Vegas like that. People will stop going there and think about everybody who works in that industry. And then even if you are not somebody who works in the hospitality industry, you're a veterinarian, well, people are going to start postponing all sorts of things. So I encourage people to make donations to the Greater Boston Food Bank or the Lexington Food Pantry, because people will need things now, and as the economy takes a hit, the impact on the need for food bank services is going to significantly go up. So everybody who spent, $200 at Costco, just a little something over to the food bank, I think could be helpful, as we really are in this together. So those were my comments.
Ms. Cuthbertson.
You mentioned working on devices for the kids that don't have them. I have a 6th grader, so she brings her Chromebook home every night. So I'm assuming for 6th through 12th graders, you already know who might need help as far as internet access goes at home if it's not readily available. But for our younger students, I'm assuming that that's going to be part of this too, either providing that service for them. I don't know how that works, but you've identified who might need that.
We have not necessarily finished identifying everybody, but we have some ideas for what we will do when we if we identify students who do in fact need that. Yep.
Thanks.
You bet.
So I'm going to ask Ms. Sarah May if she has anything to add, and I'm going to excuse the fact that Ms. Lenahan just referred to high school students as children.
In a technical sense, it in no way reflects your maturity. That I'm going to say is not necessarily reflected in all of them, some of whom who might live in my house.
I had a question for Dr. Lyons. I was just wondering, in the case that there is a school closure, the type of education that would be provided online, would it be based on like video calls and video chats, or would it be something like Khan Academy where someone posts, or the teacher posts a video and the students act based on that?
Great questions, and all of the above. We have teachers who are at all different comfort levels with using different ways of communicating with students remotely at this point. So it could be everything from sending out an assignment and asking students to send work back in related to that, which the teacher would then look at and correct. It could be that there are videos that are being posted and done. One of the considerations that we have to take into thought for that, though, is the speed of internet connections at home. And if file sizes are too big, for anything that teachers are creating. It could actually make it challenging, if not impossible, for kids to be able to access those. So we're trying to keep things mellow, but it could include chats. It could include things like Google Hangout. It could include chat rooms or documents in Google that everybody's contributing to at the same time. So lots of different variables and lots of different ways that could happen. Okay.
Ms. Sani.
I just want to piggyback on something that Kathleen said. So we have hourly employees too. So I know we're thinking a lot about curriculum, and I know you guys are great, so you're going to figure it out. Utmost trust in you all. At some point, if you could keep the school committee updated as to what you figure out, that would be great. Even high level is wonderful for us to be able to answer any questions. But if you could, after we've crossed the first sort of most important to-dos, look to that also. And again, it's Mr. Coelho could figure out, they like when there are vendors who would hurt Whitson's and.
So I just want to touch back to some of the comments that were made earlier during the public comment period, because I think it's important that everyone appreciate the degree to which everyone is taking this situation very seriously at all levels, including our school district. I think as we all read about the situation, we know that there are different approaches to how a region, a country, a government handles this. And I think some of the accounts earlier that talked about catching this, taking actions that control things early on are often the most helpful in community spread, precisely for the reasons that people are talking about, that once you get in, the spread is remarkably exponential, as we've already seen in China, we've already seen in Italy and other countries. I feel like we're at a very critical point here in our town, because things are getting a little bit closer to home, and it's certainly understandable that people are becoming more anxious about that. As far as who makes those decisions on at what point you take actions like closing schools to curtail the spread, I think it's very clear, and I think people need to understand that those decisions are made at the state level, the Department of Public Health, along with local boards of health. They are the ones who are really the experts to be looking at this situation. So in particular, a school closure, the superintendent could not make that call alone, right? Can you? You always do that in collaboration when it's a public health issue. Is that correct? So it's not that you're not able to do it; it's that you wouldn't do it without having worked with the local board of public health. So as we all know, this is going to continue to change daily, and I know that one of the things that this week is happening is that you are having a daily call with several members of the team, the Board of Health, the town manager, the health department, the local Board of Health, and some other people.
Mr. Malloy and his senior leadership team are on the call.
Facilities is on the call?
Yeah, they're on the senior leadership team. And the way it's gone so far, I had to be at Bowman this morning, so I wasn't able to join the call today, though I had many calls of other sorts with the Board of Health. The first one it started about 8 a.m. David Nealon gave an update on what the current status was in terms of health in Lexington, in the town.
and then people were able to ask their questions. So it's a place for people to be able to just get updated on the latest news and then just ask any questions that are ongoing. Because we have so many conversations school side with Board of Health, it's a repeat of the information that we've had so far in the one experience I've had anyway, but it's good to be able to have that connection.
Yeah, I think the point that is that for the community to know is that the town leadership, schools and town side are in touch with each other pretty constantly, so that as things develop, that they will be able to work together. I guess the only other thing I would say, and I think Dr. Hackett has already said it well, is that yes, there are things like attendance to policies that need to be in place, but I think she's assured everyone that the school system is really not out there to make things difficult particularly for families who are in difficult situations. And I think the school district has shown pretty clearly that they're receptive to hearing from families and will try to be flexible wherever possible. So I know there's a lot of angst about people making decisions around that and being put off or stopped by because they think that the attendance will come to bite them somehow. But I think we really do put students first and families first and family needs first. So I would say don't hesitate if you're in a situation like that and you need to double check with the district. By all means, contact the schools. Yes.
Just one quick point on that is we have begun to code based on how people are reporting the absence. So we put, and they're implementing this in all schools. This was the Director of Student Health Services suggestion to code CC, coronavirus 19 concern. That way we'll have a record of what the issue was, and we don't know where this is going, so it's hard to predict how we would use that information, but it seemed important to capture it now in our database, so it doesn't just say absence. There's a reason behind it that everyone, I think, in the United States and across the globe can appreciate these days.
Yes, thank you. That is helpful to know. So we have more on our agenda. I do feel like this is probably a point where we do want to do another community speak. So I will invite people to come to speak, especially given that you've now heard our discussion of this. We do have to be a little mindful of time because we have some people waiting to do a presentation that they've been here since early on in the meeting.
I'm still Mona Roy, and I will, firstly, I'd like to start by thanking Dr. Hackett and Dr. Lyons for really filling in a lot of questions that I'd already had, so hopefully this will be short. And I also want to thank the school committee for their care and consideration of special education families. A couple of questions that have popped up from the community. As you know, a lot of special education children also have coexisting medical conditions, and so some of them are immune compromised and because of medical conditions. And then the other side, which I don't think people catch, is a lot of special education children have behavioral issues that then make them de facto, immune compromised, for example, pica and such. So that's just something that parents are concerned about. They're not sure exactly what they should be doing if someone is immune compromised. Should they bring a doctor's note now and say at some point we might have to pull our kid out? And so is that something, I don't know if you can answer that today, but it would be good to have a communication on what parents should do in that case, because rather than just, letting them make it up. And then even if there's no mass quarantine per se, it's quite possible that some of these kids might have to be quarantined. Anybody's kids could have to be quarantined, even if there's no mass quarantine, anybody's kids could have to be quarantined. And for the reasons that you've already mentioned, there would be challenges for those children at home, even if they're not sick. Let's say a sibling or a parent was at the Biogen conference, something like that. Then The next is, I'm going quickly. Oh, I just wanted all of you to know that my husband just said that high blood pressure is a risk, so we should all be very careful in case this meeting runs too long. And then, I did want to, I so appreciate Dr. Lyons really communicating all, and you mentioned that probably going to get these plans you're having a meeting on these plans tomorrow. I was wondering when parents will know, because I don't know, so when they ask me, I still say I don't know. It would be great if parents, I don't know what your specific plan is, but I mean, it'd be great if should the parents be reaching out to the liaisons now to say, what should we be preparing for at home? You know, for some kids who have behavioral issues, it could be one set of preparation. For a kid that has, learning challenges, it could be another. So that's something, I think it would be very helpful to that community just to know that what they should be doing, because you can't do everything. The truth is the parents have to be a partner with you to get everything done. And I think, and the last question, which you probably can't answer, but in the off chance that you do have to close IEP reviews, a lot of those are at the end of the year, particularly for kids who are transitioning. And so it seems like a small thing now, but it's not a small thing for those families. So I just wanted to mention that as maybe in case there's a quarantine, someone will have to look at a calendar. So thank you so much. Very grateful to you for addressing these issues. And I feel for you, it's very difficult. Thank you.
Thank you. Dr. Hackett, yes.
I just want to respond because it's a timely question. Come right up. The immunocompromised children, you asked the question about whether or not we should have parents notify us. It would be a good idea to say, we have these concerns and this is what we're thinking of, and give us a heads up that there could come a time when they want to keep children home. That's very helpful. We will communicate out. We have on the remote learning plans, we'll communicate out after we've met with all appropriate parties, so we have a little bit more legwork to do. And then what we talked about in the Board of Health meeting and with the town manager is, and other officials, is bringing all of these plans into one location. We didn't get into the technical details yet, but for every department, we started those conversations. Mr. Coelho, Dr. Lyons, and I, in fact, had a meeting before the meeting where we started talking about what happens to particular departments. So, for example, actually, Mr. Coelho, I think it would be helpful if you talked about some of the pieces in the finance world, just to show people how we're preparing. There was one other thing, Mona, that I've forgotten that you said that was really important. So we'll be communicating out as soon as we've done all those pieces in terms of checking with the union and the educators and getting input, and then we'll make sure that everybody sees it. Your IEP comment is duly noted, and then we will fold it into, I think the vision is, based on the conversations I've been in so far, to fold it into a larger plan for the town, which would be really terrific because actually Hua made great comments about this and said it would be very comforting for residents to know that we have all of the plans in one location and people know what to do. And I wanted, Dave, if it's okay with you, to just talk a little bit about one type, when we have multiple types of contingency plans that we're talking about, emergency plans. Oh, I'm sorry, I made you wait again, too. Sorry about that. Okay. Okay, thank you. We won't be long, I promise. And
we'll make this quick.
Mr. Coelho.
There are a few things that we've actually run into because we did have a bit of a disaster recovery with the town IT's flooding. But what we do have in place now are people have access to their desktop systems through a remote access program to run payrolls. We can run AP, accounts payable for vendors if need be. The issue at that point is we have several people who can do that. Several people can do it in conjunction with one another remotely if they are unable to get in here. We're working with the town to enhance that by using the dashboard system that they've had in place. We're looking to see if there's an availability for us to get that protocol so that wherever you are. You don't have to dial into your desktop. You necessarily just have to get on the internet and perform these functions because it's set up that way. We do have successions of who's in charge of doing what and backups to those folks, and we'll keep refining those so that somebody knows how to do all of this stuff somewhere along the lines so that we do have redundancies available. And at that point, it's collating the data, getting all any invoices, timesheets, things like that that are necessary to keep things running and keep things moving in case there is an interruption in actual physical presence in the building. Yes, we've got laptops that are being set up for several of the staff, so they have at a moment's notice, or they'll bring them home every night and make sure that they have the connectivity to their local systems. So we've got those things in place right now.
Thank you.
Hello.
Yeah. I think most of our Chinese parents here agreed for me to be a representative to clarify a few things and to just summary. Thanks Dr. Hector to give so long response. And we are, first of all, I want to say that we are not asking school for, most of us are not asking for school to close now and not ask for get online teaching right away. We know everything costs money, costs time, costs whatever, and we need to do this and that. So the only thing we ask is for those family who want to have a few days start at home or home started to have opportunity. And thanks, Dr. Hector, very much that you mentioned in your current communications that you mentioned that you will, remind people about the CDC quarantine requirement, not either 7 quarantine, whatever, and you will let students to do that. You will give them support, let them to be home. And we wish this has been done since February. Okay, all right. Maybe I did not hear clearly, but in whatever case, we wish, or maybe Elaine, you can. No. I think from what I said is that I think you mentioned that for the federal CDC, whatever, if they inform you somebody needed to be quarantined, you will let them do that, right? Or maybe you can clarify that.
Not quite. I mean, okay. Maybe you can clarify. Yep. Yeah, you can clarify. There's so much information; it's hard to sort through it all. So what I was saying is what I have said in earlier communications and updates, which is we will approach situations with flexibility. Okay. So we don't know what your unique situation is. If you have an elderly parent who's very ill and you're really, really worried and concerned, we'll come talk to us. I can't guarantee or promise anything, and I'm not suggesting a quarantine. Sure,
I understand. Now, maybe it's my misunderstanding, reading. Okay, but what since February 2nd, when the federal declared the emergency, when CDC started to ask those people should be self-quarantined, right? We do not talk about people who are forced to be quarantined. We are self-quarantined. And for the previous communication, we have never heard that you say that for those required by CDC to be self-quarantined.
Can I say something, John? I think they have been extremely kind, giving us the huge amount of time discussing this. So for any details like this, perhaps we can move it offline. And so they can continue? Yeah, okay.
I'll try to do that, okay?
Okay, all right.
And cool. By the way, I have been working with people, Chinese families, for 1.5 months. And also, I think we have close to 20% Chinese American students in school, maybe more. Therefore, much more, right? Much more. Okay, whatever number is, but this is a huge group, right? And our, as Chinese American, we have an obligation to help the community in the beginning, not spread. Fortunately, in the early February, nothing happened, right? And I'll be quick because I'm representing them, and therefore nobody else probably will speak, all right? So, and the bottom line is that we were a little worried that, every communication you mentioned that I will not force people to be quarantined, right? And but you do not provide those people who needed to be self-quarantined to. You do not allow them. You do not allow high school students to do that. From February 2nd to the Italian break until yesterday, right? So therefore, we were a little bit worried about the schools spread out. That's why we asked.
Okay, I'm going to jump.
Yeah,
I'm just. I'm going
Dr. Hackett, why don't you?
No, I don't think so, okay? I'm representing probably 500, even more, okay? All right, sure. Please, okay, let it in.
Okay, so
but let me, sure. I just want to, do maybe 30 seconds. Is that okay? 30 seconds, okay?
if you have some
Yes.
new information that you would like to.
Okay.
Sure.
And okay, sure. The new information is that Lexington is probably the most dangerous town because of virus. Okay, we know there's such a huge Chinese population. It's probably passed already. We know there are a few dozen people from Italy, including the skating team. They are in Milan, including people travel there by themselves. We were told some students were from those affected areas. And also we have some other European group, so those are danger. And also the Beijing is a big danger because there are probably a few dozen Beijing people here. And also we heard yesterday there is a Beijing worker who went to the conference and who were quarantined. But his kids is still going to Lexington High. And one Chinese family parents told the high school, worried, right? Yeah.
So thank you for sharing that. Yes, absolutely.
Sure.
Dr. Hackett, please.
Yep. So, and I want to say that we need to be moving on because we've had people waiting so patiently for hours to get to the presentation, and that is not to minimize what you've shared with us. We appreciate it. So, just to be very clear, there's a question in the document that I sent out. Will LPS impose a mandatory 14-day quarantine or a self-quarantine? I'm not imposing any of those. That's not my role. I mean, that is very clearly a role statutorily on quarantine for the Board of Health. It's not a superintendent's role.
I understand. Totally.
And I do absolutely understand how confusing all of these responsibilities can be. So I'm going to just read this, and then I think maybe we can ask the presenters to come up. We have been asked if Lexington Public Schools intend to impose a mandatory 14-day quarantine, and I will add self-quarantine to that list as well, on any student or staff member who has recently traveled to countries at geographic risk. And the short answer is no. The decision to quarantine is a matter for public health. The Massachusetts Department of Public Health and the Lexington Board of Health are the enforcement agencies for the state's isolation and quarantine regulations. And I cite the law 105 CMR 300.200, and we take our lead from them. So I will not be doing any quarantine or any self-quarantine or making those recommendations. That is a Board of Health question.
Totally understand. And our request, I just want to say, no. Just one last sentence.
Yeah.
One last sentence. Is okay? One last sentence, please. Please, that's
I'm
really
sorry.
important.
I think you've had a lot of time at the microphone, so I'd like to ask you to sit down now, please.
Because Dr. Hackett mentioned that every
Mr. Chu, I'm
student
going to have to call you out of
excuse
order.
can give the virus as an excuse. I think that's a great idea. Can we try to think about that? So, because, okay, you said people talk to you about their problem, but so many people are talking to you, you cannot get approved. So if you use that excuse, if people mention that, that's good. Let people mention that, so you can make a decision later. Okay, think about that, okay? Thank you so much.
Thank you.
Thank you.
Thank you. And
Sorry
Mr.
about
Rhodes, do we have Todd Rhodes? Where are you? Yes. Come on up, Todd Rhodes. Thank you very much.
So we have our presenters here who have been patiently waiting for a good long time because we felt it was important to give this topic its due. Yep. So here's what I suggest we do. I know Mr. Rhodes has agreed to try to keep this as brief as possible, and of course, this is something that won't end here. I'm sure there'll be more investigation into it. Just for our sake, I'm going to propose that we listen to this presentation and that we table the policy readings for another meeting. Is that acceptable? And that at the end, after the presentation, you do the LHS SOI, and then we take that vote. Is that okay? All right. Mr. Rhodes, thank you so much for waiting, and I believe you have a presentation for us on electric school buses.
Not at all. Thank you very much. And again, Todd Rhodes, I'm the Vice Chair of the Sustainable Lexington Committee, and I wanted to thank you for the opportunity to present to you this evening. I'm presenting on behalf of the Sustainable Lexington Committee, and I want to acknowledge the support of two residents who helped with this material, Lynn Schenk and Ethan Kizik, and also the valuable input from Mark Sandine from the Board of Selectmen, Select Board. And I wanted also to thank Ms. Sani for recommending that we bring this topic to the committee. I have just a short presentation providing an overview of electric school buses. Please stop me if you have questions, and we can address questions at the end also, of course. My objective is to get your support to collect additional Lexington-specific information about the feasibility of using electric school buses in our town. So the material in this is pretty generic about school buses throughout the country, and the real objective is to get specific information about Lexington. Next slide, thank you. The town adopted the Sustainable Lexington Plan, or the Sustainable Action Plan, back in August of 2018. There's 10 sectors in the plan, everything from public health to energy, food, land and natural environment, and this Lexington Public Schools has led in many of these activities, from rooftop solar program, having solar on the roofs of the schools throughout town, the new Hastings School, Net Zero Energy School, great addition to the town, and organics composting has really started with the green teams in town, all things that have really moved the Sustainable Action Plan forward. So we appreciate all the work that Lexington Public Schools has done on that front. As far as transportation goes, it's a major issue as far as CO2 emissions go in Lexington. As you can see in the chart, transportation emissions represent 24% of the greenhouse gas emissions coming from the town. And the pollution associated with transportation emissions have a significant impact on public health. Next. So, while town buses contribute a small portion of our overall transportation emissions, the conversion to electric vehicles would have both a significant climate and health benefit. And so we're really looking at all buses. The MBTA is a little bit out of our control, but they'll see later that they're making significant moves in terms of electric buses. Lexpress would be a nice thing to move toward electric buses. The school buses are certainly in your purview, so that's what we want to talk to you about tonight. And the transition to electric vehicles would also send a strong signal to residents and commercial vehicle owners, the Rapids, the Rev buses, et cetera, and owners of vehicles in Lexington, and help show the town's commitment to such a program and demonstrate a path forward to reduce emissions throughout the town. So this somewhat busy chart is just some information pulled off of the town website, just to get a feel for school buses in Lexington. So based on data from the LPS website, the town runs 37 school buses. All of the little yellow squares on it just represent a route that each of the buses runs. Most of the buses run 3 routes, obviously elementary school, middle school, high school. So you get a total of about 188 routes a day. You do the math, 10 miles a day, 6 miles a gallon, burning diesel fuel. That ends up being about 1.26 million pounds of carbon dioxide emitted per school calendar year, 180 days, or the combustion of 56,000 gallons of diesel fuel. So there's a lot of emissions associated with our bus routes. And this is, and this is just the daily routes, not including any extracurricular bus driving that goes on. In addition to the carbon dioxide piece, there's also the health impacts. Diesel fuel-powered vehicles emit ambient particulate matter, PM 2.5, so particles less than 2.5 micrometers. That has been linked to health effects both in adults and children. The state identifies that about 12.9% of Massachusetts children have asthma. Children with existing chronic illnesses, particularly respiratory conditions, are most vulnerable. Pollution that results from diesel has a negative impact on folks who already have asthma and can results in onset of wheezing. And there's also evidence, emerging evidence, that air pollution like this has an impact on neurological systems and childhood development. And then there's also the added benefit of electric buses are also quieter than diesel, which is also nice around town at bus stops and as the buses are all queued up in front of our various schools. A real key point is they're coming. Electric vehicles are showing up throughout the country. Currently, based on a report out of MassPIRG, there's about 500 electric school buses on the roads throughout the country right now. As I was saying before, MBTA, they're starting to make the move. They're right now considering proposals that they will only start purchasing electric buses starting in 2030, looking for full conversion by 2040. Dominion Energy down in Virginia, utility down there, they have a program where they're looking to put 1,000 electric school buses online by 2025. California has a very big program in the works, 30,000 school buses to convert over to electric by 2040. And right in our neighborhood, Amherst, Cambridge, and Concord, back in 2016, each purchased an electric school bus as part of a pilot program that the state was running, and have had electric school bus there. And my understanding is they're each trying to, or they're trying to get more. Certainly Concord is looking at planning to expand that. And I think Beverly has put applications in to have a pilot program themselves. So a lot of towns in our neighborhood are doing the same thing. It always asks about the cost. Are electric school buses more expensive? Yes, first cost, absolutely, about twice as expensive. You see various ranges, but twice is a pretty good check. So again, the MassPIRG study identified a diesel bus costs you about $110,000, where an electric bus, $230,000. That said, if you look at the life cycle cost of an electric school bus, you're saving money every year through fuel and maintenance. Electric vehicles, if anyone owns an electric vehicle, you'd be aware, no oil changes, very few moving parts, so there's very few things to go wrong. Concord did have some issues with the maintenance of their bus. It was the headlight had a problem. They had to wait for a part to get replaced and so forth. But that's the kind of things you're running into because there aren't really many parts to wear out on an electric bus. So just from fuel and maintenance, you have annual savings. And then a very significant opportunity is what's referred to as vehicle to grid. So if you have an electric school bus, well, and actually school buses are kind of ideal for this because you have the ability to take the electricity from the battery and send it back into the grid and earn revenue from the utility back from the energy that is being stored. So you charge up the batteries during low peak times and sell it back to the utility when they need the power at high peak times. And you can particularly think about this from the perspective of a school bus that's sitting in a lot all summer long. And that's when people are running their air conditioning. So if the utility has the opportunity to say, okay, that charging station has 37 school buses sitting in it, and everybody's ramping up their air conditioning, let's start pulling some power off of those batteries, and then we'll charge them back up tomorrow night. And there's an opportunity to make some significant benefit in dollars from those batteries that are sitting there waiting to be used. All that considered, all that considered, payback is about 13 years based on the Mass PERG study. So overall life cycle is cheaper with electric bus. So the big question then, is it feasible for Lexington? To know if electric vehicle or EV buses are feasible for Lexington, there's a bunch of questions that need to be answered. Around what's the current performance needs? What's the range that our operations folks in the LPS organization, what do they think they need? What is the uptime they need for it in order to deal with standard routes, field trips, et cetera? What's the likely vehicle count going to be in the future? I know with the change of school times and so forth, the logistics are all changing. How many vehicles does the group think they're going to be needing down the road? Since we don't own our buses, Concord, and I believe both Amherst and the other town, there we go, Cambridge, all own their buses. So they had a different model to deal with. We contract that out. But since we don't own our buses, is our contractor interested in that transition? So we would very much like to speak with them. Are there other partners, Eversource, battery manufacturers who would support such a program? And what other business models, incentives, financing structures are available? State programs to help cover that first cost issue, loan systems where you would get a loan to cover off the incremental additional costs of the bus originally, and then you pay it off as you incur the benefits, the lower cost operations throughout the life of the bus. Things like that need to be considered. And then any other questions that the school committee or the Lexington Public School Operations folks think would be important to address. And the last page. So, all that said, what we're really looking for is just your support for our group to get in touch with the folks in Lexington Public Schools and the operations group, collect some of that information about what they see are the performance needs and constraints, concerns they might have, evaluate the costs and requirements of the existing contract and explore what the possibilities are with our contractors, see what their thoughts are on the potential for using electric buses in Lexington. Get more detail from the local towns, find out exactly what Concord is doing. They're very open to giving us all a tour. Anybody from the school committee or LPS who would want to go over to Lexington and see exactly how they're set up and what they're doing. So get a sense of the issues associated with running the bus. They're very open to that. And as I said before, what grants, incentives are available, and put all that together into a more thoughtful report using real data from Lexington in order to come back to you all in, say, the June, July timeframe and say, all right, conceptually it sounds like a good idea, but based on real data from your operations team and what they see happening in the future, here's what we think the opportunities might be. Here's what Eversource is saying they would like to pitch into the program to help make things financially viable. And here's what we're learning from our neighboring towns. And so, again, my request is just to get your support to reach out to folks on staff and be able to take a look at the existing contract with the contractor for the bus contractor to understand the financials and the needs so we can put that kind of a report together for you. And thank you very much.
Thank you. That was a very efficient presentation. Thank you so much at this hour. That's a really important thing. So I'll put this out to my colleagues for any question for Mr. Rhodes. Ms. Cuthbertson.
Well, thank you very much. This is really exciting. I actually, a parent that was at the preschool where my daughter went, it was on the committee in Concord. So I had seen, he had sent things out months ago. So I actually read the report when they did the study, the pilot. So I read that report. So I was looking through, and I think a lot of the pitfalls that they identified there are very helpful for other communities going forward to mitigate some of the things that they dealt with. But I have a question about the financial impact chart. So I know you calculate the savings. One of the things they identified in the chart in the pilot that they were not able to do because of the upfront cost was the vehicle, but theirs was vehicle to building, and I'm not sure what the difference is between vehicle to building and vehicle to grid, and you don't really need to explain that all, but they said it was about $10,000 upfront for a unit. Is that rolled into the cost of the bus in this chart, or is that an additional cost?
No, the charger would be separate. But then there's also the question of who would own the charger.
Right.
Maybe Eversource would want to have that part of the puzzle.
Right. And I know they identified issues with vampire loads with the unmonitored charging. Or vampire loads sound really thrilling, but they're not apparently.
And they were charging, they were getting peak demand charges as part of it. And so, they learned a few things about that piece of it that would you wouldn't want to do going forward.
The other question was, the annual maintenance, they did identify that the costs were lower, but they also identified that their buses were out of service more because of the fact that we don't have local maintenance locations. But near the end of the pilot, they were able to remotely handle some of the issues, which was great. So I'm hoping that makes it a little bit better. But I'm wondering, if the annual maintenance is lower, but that means we're keeping those buses out of service. That does mean that we'd be relying on our diesel backup buses too. So there would be some cost associated with that.
Yeah, and there's it's kind of the pilot versus where the world is going also, because Lion they get their buses from Lion Company, bus company, and I think Brian at Concord had said that Lion is building a parts depot in the Massachusetts area, so that's so the world is moving in this direction to solve a lot of those problems.
Okay, thank you.
Thank you, Mr. Boken.
Thank you very much, Mr. Rhodes. I'm an electric car guy. My car has been charging since I got to this meeting, so it'll be fully charged when I leave. Just over here. My question, with that same chart. You mentioned that it's within 13 years of operation, it pays for itself. How many years do you think after that is the bus still viable?
That's a good question. I don't know. And everything in this MassPerg report, this is where these numbers, I tried to just cite, established reported numbers, just focuses on a typical diesel type life. That said, given the few number of moving parts in an electric bus, you would suspect an electric bus would last a good bit longer than a diesel bus. But that's a good question to resolve in what we look up.
Yeah, exactly.
Part of our study.
Yeah, I've never taken my car in for service. I've had it for 2 years. That's great.
Exactly.
Well, once it had a recall, but that was a computer program thing. But my other question was, do you think it's possible to have solar charging to take care of the buses in a parking lot where they're kept?
Yes, it's certainly possible. Citing it might be a question, but that'd be a great.
I guess the bigger question is, are there enough panels to charge the fleet of buses in one?
I'll look.
Do you know what I'm saying? How many would that be?
I'm pretty sure the answer is no, but I'll look into the audience. No.
Okay. Thank you again.
Yeah.
Other questions? Okay, Ms. Lenahan.
Thank you for the presentation. It sounds great. People in Lexington are really committed to green initiatives and doing what we can. Just going forward, again, the real issue is the cost, and especially I'm just thinking back to our budget conversations at the budget summit, and if we're looking at shortfalls in our allocations, what does that mean if we were potentially looking at cutting some things? How do we then spend more on this? It doesn't mean we can. It just means that there might be some very difficult choices of something that we currently have that we'd have to cut in order to have the buses and electric buses. And given what's going on with the economy, those conversations could be all the more difficult. It's not to say we don't do it. It's just difficult choices.
And to that point, certainly the objective and what we would look at is to put together a model, an approach that the cost would be at least comparable, if not cheaper.
Ms. Sani.
So I'll just give a little background. So we met, how many weeks ago? I can't remember. But so it was a brainstorming session to some extent. They were bringing me up to speed as to what is currently out there with electric buses and school systems. And so as my colleagues have said, there are a lot of questions that we still have to figure out. We have to look at the Concord model better. It's so great to know that you are well versed in that stuff. So the idea was to, and Kathleen, we completely understand that, we do have budgetary constraints. So the idea was to see how would an electric bus model fit in our current Lexington, all the environment with all the constraints and issues we have. The idea in itself is very desirable. And we've already seen that in Lexington streets, the number of Teslas and other electric vehicles has gone up, thank God, as the traffic has gone up. So it's very desirable. And the idea is to do a quick project, not project, like a quick, I'll call it a project. Do it quickly in 2-3 months, figure out, get some sort of an idea as to whether this is at all feasible in the Lexington context. Maybe if it's not feasible tomorrow, is it feasible in a year, 2 years? Get it just also to get an idea as to what are the other funding sources that we can call upon, because we all realize that we do have constraints.
Yeah, I agree with what's just been said. Of course, this is an intriguing idea. It would be interesting to know what is feasible for us and how to do it within the kinds of budget constraints we may be facing coming ahead, which may then lead to further investigation of, I don't know if there are other state monies still for pilot programs or other types of grants that could be explored. I'm hoping that could be something that our new sustainability director may be able to assist with. I would hope that's the kind of expertise that person might bring to the table. So I guess I think this is interesting enough to at least take the quick pass at say learning. So I think for me the question is, how deep a dive does one have to do in getting a sense of feasibility to at least know whether it's worth continuing to pursue rather than, I get the question, I think, is how much would that take? Because I don't know that we necessarily want people spending a huge amount of time drafting elaborate reports on this. Is there a way we can start learning about this sort of at the higher level, learning from other communities, talking with our contractor about feasibility? Because we don't own our own bus fleet, so it's a different kind of thing for us. I'm just wondering if there might be some opportunity to just start with a high-level presentation for some of us, or maybe from the municipal side as well, if they're interested in learning more about it, so that we know how to proceed.
Well, I think if we had an opportunity to meet with the operations group, the transportation group, and get a sense, get better numbers on, exactly, how many miles are our buses going this year? How many buses are we expecting to have in the system for the next, next 5 years? What are the constraints that they see and the concerns they have? And then, as you point out, reach out to Concord, learn a little bit more about what they're doing. I think the folks at C&W have already expressed an interest in talking about the opportunity, for electric buses. To be honest, if C&W and other school bus contractors aren't already thinking about electric buses and how they might be able to use them to save money for their customers and reduce their costs also, they're a little bit, they're behind because everyone else is doing it. And we had a conversation a couple weeks ago saying the market for diesel school buses is going to get really, is going to really tank in a few years as the number of people buying electric vehicles starts ramping up. So I think C&W would be interested in talking about us. We'll see what they have to say. And after those conversations, I think we will be in a really good position to come back to you and say, just as was mentioned, we think this is a really good idea, but for Lexington, it's a really good idea 3 years from now. Or we might say, you know what, looks like based on what the operations folks are telling us, there's a really nice opportunity for, say, 5 electric buses that would work in this part of town. And until we have those conversations and look at the contract and so forth, we really wouldn't be able to give you that kind of insight. So just the opportunity to collect information for the next few months and report back to you in June or July is really what we're looking for.
Yeah. Dr. Hackett.
Hi.
Hi.
I think this is very exciting, and I'm thinking back to our conversations about later school start, about redistricting, and all of the challenges that we talked about could in part at least be resolved or, I don't know, reduced by having an electric vehicle, an electric bus. So I think that's very exciting. You're looking at the facilities guy right there, Mr. Coelho. So happy to introduce you to him, and probably Elaine Shelley, transportation. Reaching out to C&W is fine. I know there have been some preliminary talks. I would suggest as another possible strategy, they work for us. We've given them a contract. Their contract is up in a year or so.
22.
Yeah. So in terms of how we structure that next contract, that's a school discussion, and what we want to see in it can, help people respond to what the community desires. And this certainly falls along what we've heard from community members about what's important. So I think it's really exciting, and we're happy to work with you. And I'd love to take a ride on the on the electric bus in Concord anytime. Thank you.
Great.
Thank you. Ms. Soni.
So just to help things along, it's really nice when you're talking to somebody and say, oh, you're the task force from Lexington, which is looking at electric buses. So it just formalizes it a bit. And also, we have to be very mindful that these same people are dealing with the redistricting, and also, just being mindful about how much time we take, and we have very crisp questions, so they can get us very crisp data, and there is no back and forth, inordinate amount of back and forth. So can we, or do we need to take a vote or something to create that little task force?
I guess it is an interesting question of what the next step should be, because as you said, there is a lot going on, and devoting additional, another structure to review this would take away staff time as well as hours. So maybe we can find a way to progress on this.
I think, if I'm being completely honest about the time constraints, they're very limited because of what we have going, which is not to say we're not interested. So if it could be the case that you take the lead on it, and then you invite key players in when it's the right time, I think that would be perfect. I'd be happy to attend a meeting. Mr. Coelho and Elaine Shelley could give you information as needed. For us to be ongoing members of a task force right now would be really tough. And it's, I mean, just because we have redistricting, late start, master planning, coronavirus, budget, a few things going, but don't take that as a lack of interest, because we really are interested, and we'll do the best we can in terms of outreach and trying to support you. But if you can establish your own task force and bring us in as needed, that would be perfect.
Yeah, that sounds fine.
Great. Thank you so much. This is very exciting and very much in line with some things that we're trying to be forward thinking about. And whenever that becomes feasible and a possibility for us, I think we're interested in hearing about it.
Great. Thank you very much.
Thank you.
Thanks for waiting for so long.
Yes,
too.
I'm so sorry that you had to wait for that. Thank you. So just a few things that I think we can dispense with quickly. We have to jump back to early on. We have to do the consent agenda, and we also have to do the vote on the submission for the SOI for the Lexington High School.
Can I do the SOI and then go to the bathroom?
Yeah, of course. So why don't, no, we lost, okay. So let's take up the Lexington High School SOI.
The Lexington High School SOI gets resubmitted again. I have an incorrect date listed in that resolution. I was hoping to get the submission in. If you remember, they indicated that we can resubmit just as is. And I got that reassurance 3 times, so that's the plan. I was hoping I would have had that done yesterday. It requires me to have certain codes, and the uploading is always clunky. That's the best word I can say because of the system that they use. And Eileen's chuckling because often we have to go back 3 and 4 emails until we finally can get this submission through, because it requires her to be sort of at the ready, and then Mr. Malloy. But what I would suggest is that you, it says March. Okay. Here's the part that I want to modify. So it says, the Lexington High School Statement of Interest is due on April 8th. Prior to our submission, the school committee and select board must vote to authorize the superintendent of schools to submit to the MSBA the Statement of Interest form dated March 9th, 2020. It's not dated March 9th, 2020 because it hasn't been uploaded yet. The upload will time stamp the date, time and date stamp. So Thursday, I don't want to do it on Friday. I would like to do it on Thursday, the 12th. If we can change that date to then.
No, the date that's in here is the date of this meeting, so this has to stay as March 10th.
Also, I'm looking at the
Right.
motion. 2020. I mean, is this
20.
not what we're?
Oh, I'm sorry. No, don't look at the agenda sheet because the language is very specific on what you have to say. And I believe that you have copied all of that in here. Is that correct?
That's correct.
So is the motion going to be this entire section
Yes.
here? So as I read it, the resolution starts, having convened an open meeting on March 10th, which is today, the school committee did so.
2020.
Right, 2020, yes. So, but not the 12th. That may be a date you'll.
No, but there are
submit.
2 dates, so you're correct. Having convened in an open meeting on March 12th,
Today is the 10th.
I mean,
Right?
excuse me.
That's okay, it's late.
Who's on
You're
first?
excused.
It's
You
March
are-
10th.
You are excused.
March 10th,
Terrence.
2020.
Okay, now
Yeah,
we're
I
good.
know. Okay, I was half right. I know. Oh, we're going to get through this. March 10th, 2020, right?
Yes.
Right. Prior to the SOI submission closing date, the School Committee of Lexington, Massachusetts, not a capital A there, in accordance with its charter, bylaws, and ordinances, has voted to authorize the superintendent to submit to the MSBA the Statement of Interest form. Here's what I was talking about.
Yep.
Dated, and I would like it to say March 12th
Okay,
to give me
that's
time
the
to do
one.
the
Yep.
upload.
So that-
So I'm
that's the
half
one.
confused. March 12, 2020, and then all of the rest of the language which somebody can read.
Okay.
Yeah.
So,
Exactly. Fast, right.
so moved. No, it doesn't work that way. You got to read all.
Okay, let me just, can I
Yes.
say one more?
Yes.
One more thing. The vote, this is always confusing, but you're authorizing me to submit. So that's the language. You don't even necessarily have to see the actual content of the statement of interest. In this case, we're in a unique position. We have it done. In all cases, I will always try to get it to you first, because it's good to know what's ahead. But there are so many steps in the process that it's not as though either board were saying, go ahead with the project. You're just saying, we authorize the superintendent to submit. Mr. Malloy reached out this evening and asked about me joining the select board, I believe next Monday, to go over the document like I did before, which I'm happy to do. There's a bunch of materials, minutes.
Okay, first, any questions? Or we're set to take this vote? Okay. Looking to see who's the most alert here. I'm going to call on Mr. Boken. Because he got the date right. Okay. So you actually have to say the word resolved. So I think it starts like, be it resolved that, and then you have to read the entire paragraph.
The entire paragraph that goes
Yes.
on the next page. I'm with you.
Correct.
Be it resolved, having convened in an open meeting on March 10th.
Hold on. Okay. Start. No, we are the ones who are taking the vote. We are authorizing her to submit. So please make, it's in
I'll
the
go
superintendent's
slowly.
report.
Be it resolved, having convened in an open meeting on March 10th, 2020, prior to the SOI submission closing date, the School Committee of Lexington, Massachusetts, in accordance with its charter, bylaws, and ordinances, has voted to authorize the superintendent to submit to the Massachusetts School Building Authority the statement of interest form dated March 12th, 2020, for the Lexington High School located at 251 Waltham Street, which describes and explains the following deficiencies and the priority categories for which an application may be submitted to the Massachusetts School Building Authority in the future, including replacement or renovation of a building which is structurally unsound or otherwise in a condition seriously jeopardizing the health and safety of school children where no alternative exists, the elimination of existing severe overcrowding, the prevention of the loss of accreditation, the prevention of severe overcrowding expected to result from increased enrollments, replacement, renovation, or modernization of school facility systems such as roofs, windows, boilers, heating and ventilation systems to increase energy conservation and decrease energy-related costs in school facility, and replacement of or addition to obsolete buildings in order to provide for a full range of programs consistent with state and approved local requirements, and hereby further specifically acknowledges that by submitting the statement of interest form, the Massachusetts School Building Authority in no way guarantees the acceptance or the approval of an application, the awarding of a grant, or any other funding commitment from the Massachusetts School Building Authority, or commits the town of Lexington to filling an application for funding with the Massachusetts School Building Authority. Let's do it. I'm going to go one by one.
I think that we do need to read the whole thing.
I agree.
Oh, all right. So Ms. Linehan has volunteered to read it.
I move that we accept the donations and gifts, the approval of the 2020 LHS PTO mini grant award in the amount of $750, and approval of prom donation to class of 2021 in the amount of $1,000. I also move that we accept the payroll and accounts payable warrants Approval, February 28th, 2020, accounts payable, BMO Bank of Montreal in the amount of $36,863.86. The February 28th, 2020, accounts payable in the amount of $1,367,621.73. February 28th, 2020, payroll in the amount of $3,863,055. It's late. $3,863,055.87, and the approval of the school committee minutes of February 25th, 2020.
I second that. I second that.
All those in favor? Aye. Thank you. Consent agenda is approved on a vote of 5-0. Thank you very much. I believe that is the last item on our agenda. We normally end with the last session of Community Speak. We have one member of the audience, if he wishes to speak, is welcome to do so. Otherwise, we will. Otherwise, I'll take a motion to adjourn.
I move that we adjourn.
Second, all those in favor? Thank you.